चैट के लिए इस पे करना। So good afternoon, everyone. For those who don't know me, I'm Dr. Omkar Sangeeta Diliprao Sonone, in short, Dr. Omkar. Yeah, the PDF will be shared at the end of the session. Don't worry, after every class, I'll share the PDF. So you don't need to worry about that. But I'll appeal you to make your notes by your own. If something is missed, then definitely you can refer to the PDF. But it's always better to make your own notes. That will be remembered for a longer duration of time. Okay? So hopefully all of you are doing really well. All of you have started studying already. And yeah, two important things for those who have joined my class for the first time. First condition will be it's important that you revise all the content which has been taught to you on the same day. At least by revising, I don't mean you have to go line by line, because if it is a long hours of class, I also understand sometimes it is humanly impossible to do everything. Okay? So for that particular day, उस दिन के लिए at least you have to glance through the pages. At least क्या पढ़ाया है वो एक बार देख लो, उन पे एक बार नजर मार लो, उन points पे. Definitely you will remember it for a longer duration of time. And second thing is you have to solve MCQs. You can use your sources for your MCQs. Important is solve MCQs, but read their explanations. That are more important. ठीक है? Now, important is we have completed first part of biochemistry where I discussed about vitamins. I started with vitamins, which is the most important part of your examination also, and I actually completed your fat soluble vitamins. For those who are new to the session, don't worry. We will just revise it in a crisp and a concise manner, and then we will move further to the water soluble vitamins. Then we'll complete minerals, and then we'll start with basics of biochemistry, and then further carbohydrates, amino acids, and finally fats. ठीक है? No issues with this, anybody? चलो, ठीक है? If you have any doubts, you can just pin in the chat box. Hello guys. चलो. So let's start. सबसे पहले we have discussed in the last class itself what are vitamins. Amines क्यों बोला जाता है? Amines because they contain a NH2 group in it. Okay, they are called as amines because they actually contain a NH2 group in it. Therefore, they are referred to as amines usually. Okay, therefore they are referred to as amines. Just a minute. Okay, and important is vitamins. Why? Because these amines are vital for your body, for the maintenance or for the survival of your body. These amines are very vital, therefore they are called as vitamins or vitamins. Okay, important is that. Now what are vitamins? Vitamins are organic compounds actually. Okay, what vitamins are? Organic compounds which are required by the body for its metabolism, or which are required by the body for its survival in minute quantities. They are not required in larger quantities as carbohydrates, proteins, or fats, but they are required in minute quantities usually, and they are essential. What do I mean by essential? Any substance which is not synthesized in the body, any substance which is not produced inside the body. Okay, please remember, any substance which is not produced inside the body, but you have to take that in your diet, that is called as essential. So vitamins are also considered essential for the body. Okay, so as I've told you that most of the vitamins are not synthesized in the body except two. Okay, most important, and these are called as your atypical vitamins. Which are these two important vitamins? So the two important vitamins which are synthesized in your body, one is definitely vitamin B3, that is also called as niacin, and second is vitamin D or vitamin D3, whatever you call it. Okay, so that's important. These are the two vitamins which are produced in your body. Vitamin B3 or niacin, we'll talk about it. Okay, it is produced from an amino acid. Okay, from an amino acid known as tryptophan. What happened? This is not the first class, but for those who have joined it late, definitely for them, I'm trying to revise it once. Okay? So we will get a continuity also in the session. Okay? So that's the reason. No issues with this? Chalo. So vitamin B3 and vitamin D3 definitely, okay, they are synthesized by your own body. Okay, only two vitamins which are synthesized by the body itself. But there are also other vitamins which can be synthesized in the body, but they are not synthesized by your own body. तुम्हारी body मेहनत नहीं कर रही, तो कौन बना रहा है तुम्हारी body में? I hope all of you are quite aware. In our intestine, we have some bacterial flora. So those bacteria actually produce these three vitamins. Okay, one is vitamin K2, second is vitamin B5, and the third is vitamin B7. No issues with this, anybody? Vitamin K2, B5, and B7 can be synthesized by the intestinal bacterial flora. And the vitamins which can be prepared inside the body, they are called as endogenous or atypical vitamins. Okay, so that's important. Now, vitamins are classified into water-soluble and fat-soluble vitamins. So the fat-soluble vitamins are vitamin ADEK, that is vitamin A, vitamin D, vitamin E, and vitamin K. Whereas water-soluble vitamins are vitamin B complex. Why do we call it vitamin B complex? Because there are multiple subtypes of vitamin B. That is vitamin B1, vitamin B2, vitamin B3, vitamin B5, vitamin B7, vitamin B9, vitamin B12. Okay, so these we will be talking about today. And next is vitamin C. This is also considered as a water-soluble vitamin. Important is fat-soluble vitamins, as they can cross. Definitely we know fat-soluble substances can cross the cell membrane easily. Why? Because the cell membrane is also made up of fat or lipid. Therefore, these fat-soluble vitamins can cross the cell membrane. They can enter inside the cells or the tissue, and therefore they can be stored over there. Okay, and anything which can be stored, there are high chances that there can be a toxicity of that particular substance inside your own body as well. But on the other hand, water-soluble vitamins cannot cross the cell membrane. That is the reason why they are present only inside the blood itself. And as they are present only inside the blood, they are not distributed in the organs or inside the tissues. They only remain inside the blood. Okay? They will be excreted out by your kidney. And therefore, toxicity is not possible mainly for water-soluble vitamins. Exceptions are two. One is definitely vitamin B3 and second is vitamin B6. These are the only two vitamins, water-soluble vitamins, where toxicity might be possible. Not always again, might be possible. Okay? So that's important. Fat-soluble vitamins will have varied function. That means multiple functions होते हैं. हर एक का अलग-अलग function होता है. But water-soluble vitamins, on the other hand, they mainly have a coenzyme role. What do I mean by a coenzyme role? कोई एंजाइम होती है, उसको किसी ऑर्गेनिक सब्सटेंस की मदद चाहिए होती है फॉर इट्स एक्शन और फॉर इट्स एक्टिविटी. That organic substance will be your water-soluble vitamins, and these substances are called as coenzymes. ठीक है, मदद करने वाले एंजाइम को और coenzymes, and these are mainly your water-soluble vitamins. Vitamin A we have discussed, that is a fat-soluble vitamin. It is derived from plants or animals. From plants, it is derived in the form of beta carotenoids. Okay, whereas in animals, it is in the form of retinoids usually. ठीक है, important is ठीक है, retinoids, they are the forms of vitamin A. They exist actually in three forms. One is the alcohol form known as retinol, second is the aldehyde form known as retinol, and third is the carboxylic acid form known as retinoic acid. रेटिनॉल का फंक्शन क्या होता है? रेटिनॉल बच्चों इज रिस्पॉन्सिबल फॉर रिप्रोडक्शन. रेटिनल जो होता है इट इज रिस्पॉन्सिबल फॉर योर विजन. ठीक है, एंड रेटिनोइक एसिड व्हिच इज देयर, इट इज रिस्पॉन्सिबल फॉर ग्रोथ ऑफ द बॉडी और फॉर टिश्यू डिफरेंशिएशन. ठीक है, इंपॉर्टेंट इज दैट. ओके, एंड वी नो दैट दिस retinol which is there, this 11 cis retinol is converted to all trans retinol, and this is what is called as definitely the Waltz visual cycle. This is known as the Waltz visual cycle. Okay, this is responsible for your vision. So therefore, in cases of vitamin A deficiency, this Waltz visual cycle will not work properly, and that is the reason the patient will develop night blindness or nyctalopia that we discussed as well, right? Now, vitamin A will be stored in the body, right? And it is stored in the form of retinol esters, bachcho. Okay? So it is stored in the form of retinol esters. Important is this question, where is it stored? So please remember, vitamin A is generally stored in the perisinusoidal cells. Okay? Vitamin A is stored in the perisinusoidal cells usually. Okay? Just a minute. So vitamin A is actually stored in the perisinusoidal cells, that you have to remember. So what are these perisinusoidal cells? These perisinusoidal cells are usually located in the liver. Okay, so these are also known as, please remember, these are also known as the Ito cells or the stellate cells. This was a previous year question. Where is vitamin A stored? So vitamin A and fat, usually both of them are stored actually. Please remember, both of them are definitely stored inside the perisinusoidal cells of liver, also known as the Ito cells or the stellate cells, that you have to remember. Okay, transport of vitamin A inside the blood, as it is a fat soluble substance, it will require help of something else to be transported inside the blood. Therefore, vitamin A in blood is transported in the form of ternary complex. तीन चीजें क्या होती है बच्चों ternary complex में? One is definitely vitamin A, that is in the form of retinol. Second is this retinol binding protein, and third is transthyretin usually. ठीक है? In the national immunization schedule, that means जब हम बच्चों को वैक्सीनेशन देते हैं, this is important from PSM, please remember PYQ भी है, recent exam, कल की जो एग्जाम हुई है उसमें भी क्वेश्चन था. So the dose of vitamin A is how much? If the child is less than 6 months of age, we give 50,000 international unit. 6 months to 1 year of age, we give 1 lakh international unit. And if the child is more than 1 year of age, usually from 1 year of age till 5 years of age, okay, 2 lakh international unit is given. Okay, that's important. In the national immunization schedule, the first dose is usually given at 9 months of age, and that is 1 lakh international unit as the child is less than 1 year of age. Okay, from 1 year onwards till 5 years, that means 4 साल तक हर 6 महीने में दिया जाएगा. Every 6 months vitamin A will be given, and that dose will be 2 lakh international unit. So the total number of doses will be 9, but the total dose will be 17 lakh international unit. That you have to remember. Deficiency of vitamin A is known as xerophthalmia, bachcho. The most common and the earliest symptom. What is symptom? The patient's complaint. That is called as a symptom. Sign, what you will identify as a doctor or an examiner. Okay? So the most common and the earliest symptom of xerophthalmia is definitely, you have to remember, night blindness. It is also called as nyctalopia. Okay? Whereas if I talk about the most pathognomic sign, again a PYQ, most pathognomic sign or the most characteristic feature, most specific feature of vitamin A deficiency or xerophthalmia, it has to be these chalky plaques on the sclera. That is what is called as Bitot spots. Okay, so these chalky plaques on the sclera are known as Bitot spots. Okay, important is WHO classification of vitamin A deficiency which is there, or xerophthalmia. It is X1A, that means conjunctival xerosis. Okay, and we know that conjunctival xerosis is the earliest sign of vitamin A deficiency, right? Before that, definitely, if you have an option, loss of sensitivity to green light, that will be the best answer. Earliest sign, loss of sensitivity to green light. If that's not another option, then definitely you have to mark it as conjunctival xerosis. Xerosis, but is nothing but dryness. So dryness of the conjunctiva will be called as conjunctival xerosis. Okay? So earliest sign will be either loss of sensitivity to green light or it can be conjunctival xerosis. That is X1A. X1B, B stands for Bitot spots. ऐसे याद रख सकते हो. That has been asked again on PYQ. Okay, so X1B means Bitot spots usually. X2 means corneal xerosis or dryness of your cornea now. X3A means keratomalacia. X3A means keratomalacia. X3B means corneal ulceration. XS means xerophthalmic scarring. XF means xerophthalmic fundus, and XN means night blindness usually. Okay? Important is vitamin A deficiency can be seen in patients who are also having an essential fatty acid deficiency. Q? Screen not visible. Okay. स्क्रीन का कोई दिक्कत है, एक बार देख लेना. जस्ट अ मिनट. Okay. Now hopefully it will reappear. Okay. Chalo. Okay. So now if the patient is having essential fatty acid deficiency, bachcho, that patient is also at a high risk of developing vitamin A definitely, because it is a fat soluble vitamin, right? And in essential fatty acid deficiency, the patient develops a condition known as phrinoderma. In phrinoderma, I've told you the skin is very rough. Okay, it looks like toad. Toad is nothing but a version of frog, you can remember. Okay, so toad-like skin is usually seen. Why? Because there are small papules on the extensor aspects. That means on the elbows or on the knees now. Okay, there will be some small papules, and these papules are usually due to follicular hyperkeratosis. It is due to follicular hyperkeratosis. And second feature will be dry skin in the patient. Okay, so these are the features of essential fatty acid deficiency, which is known to cause vitamin A deficiency as well. We know that vitamin A deficiency, bachcho, is the most common cause of blindness in childhood, or we can also remember it is also the most common cause of preventable blindness, because it can be prevented by vitamin A supplementation, which can be given to the children. Okay. Now, fat soluble vitamin, vitamin A is a fat soluble vitamin. Therefore, there are chances of toxicity, and toxicity of vitamin A will lead to pseudotumor cerebri. Pseudotumor cerebri. Tumor cerebri means brain tumor. Pseudotumor cerebri means the condition is having symptoms like brain tumor, but actually it is not brain tumor, it is vitamin A toxicity. Okay? Here the patient will have features of raised intracranial pressure. Okay? So that is the reason why it is called a pseudotumor cerebri. Treatment purpose के लिए भी vitamin A is used, बच्चों. The 13-cis-retinoic acid form of vitamin A is known as isotretinoin, and this is important. This isotretinoin is considered as the drug of choice for grade 4 or the most severe form of acne known as nodulocystic acne, बच्चों. ठीक है? So that has been asked again as the previous year question. Next important, the richest source of vitamin A. Again a PYQ. Richest source of vitamin A is halibut fish liver oil. Richest source of vitamin A has to be halibut fish liver oil. And richest plant source has to be ripe mango. Okay, richest plant source or richest fruit source. Okay, it has to be ripe mango usually. Paka hua aam. Richest vegetable source, if they ask you, then that has to be carrot. The recommended dietary allowance of vitamin A कितना देना चाहिए usually, कितने की need होती है? In a child it is around 400 micrograms, whereas in an adult it is around 800 micrograms to 1000 micrograms. ठीक है? So that's important about vitamin A. Next was vitamin D that we discussed. Vitamin D, we know it is called as an atypical vitamin. Why? Because it is one of the two vitamins which are prepared or synthesized by your own body. Therefore, it has to be called as an atypical vitamin because most of the vitamins are not prepared inside the body. ठीक है? Plant source of vitamin D is what is known as ergocalciferol. Okay, please remember. Okay, it is known as ergocalciferol. Ergocalciferol is not present in humans. That's important. Active form of vitamin D, bacho, it is known as vitamin D3. And can you believe this was a previous year question again? Okay, it has been asked what is the active form of vitamin D3, and the answer was calcitriol. Okay, so the active form of vitamin D3, bacho, is known as calcitriol, also called as 1,25 dihydroxycholecalciferol. Okay, synthesis of vitamin D we discussed already. On exposure to sunlight, which rays are present in the sunlight? Ultraviolet B rays usually. On exposure to these ultraviolet B rays on the skin, definitely the 7-dehydroxycholesterol. This is again a PYQ. What is the precursor of vitamin D? We know the precursor of vitamin D is definitely 7-dehydroxycholesterol. So from 7-dehydroxycholesterol, 24-hydroxycholecalciferol is formed. 24-hydroxycholecalciferol is formed inside the liver. This 24-hydroxycholecalciferol will go to the liver, and now here it will be converted to 25-hydroxycholecalciferol. After this 25-hydroxycholecalciferol will finally enter into the kidneys, where the final step of vitamin D synthesis will occur. Here we have the rate-limiting enzyme, again a PYQ, the rate-limiting enzyme of vitamin D synthesis, and that is called as 1-alpha hydroxylase. The rate-limiting enzyme of vitamin D synthesis is known as 1-alpha hydroxylase, which converts 25-hydroxycholecalciferol to 1,25-dihydroxycholecalciferol, also known as calcitriol, which is the active form of vitamin D. Actually, this is a revision, so that's the reason why I'm speeding it up, because we have to proceed further as well, right? I hope so that the previous class was recorded. Hopefully, I'm not sure about it, but yeah, it would be recorded as well. Okay. So important is vitamin D बच्चों has important functions. It is known to increase serum calcium and serum phosphate level. दोनों की level बढ़ाता है वो. And important is, please remember, it will act at 3 important sites or organs. First is intestine में. In intestine, it will increase calcium and phosphate का absorption. In kidneys में, it will increase calcium and phosphate का reabsorption. Therefore, the levels of calcium and phosphate will rise inside the body. Okay, and in bones, definitely, it will cause calcium and phosphate deposition. So if calcium and phosphate deposits in the bones, that is what is called as mineralization of bone. And that will make the bones much, much stronger. Okay, that will make the bones much, much stronger. So please remember that usually vitamin D is required for making the bone stronger, definitely. That is for mineralization of bone. So if there is deficiency of vitamin D, mineralization of bone will not occur properly. And that is the reason the patient will develop either rickets or osteomalacia. Okay? Yeah. I understood that already. Now the screen is appearing. Okay? So please remember this, bacho. Deficiency of vitamin D in children, it is known to cause rickets, whereas deficiency of vitamin D in adults, it is known to cause osteomalacia. Malacia ka matlab hota hai weakness. Okay, so osteomalacia means weakness of the bone. Right? That's important to be remembered. The recommended dietary allowance of vitamin D, bacho, in adults or in pregnant women, it is same in everyone. It is 600 international unit. The only exception you have to remember is infants. This was a PYQ again. The recommended dietary allowance of vitamin D in infants is around 400 international unit. It is 400 international unit. Okay, important is that. Usually, in infants, we give vitamin D supplementation. We give vitamin D supplementation in infants. Why? What is the reason? Because the breast milk or the human milk which is there, bacho, it is deficient in 2 vitamins. The most deficient vitamin in human milk or breast milk is vitamin K followed by vitamin D. Okay, so it is vitamin K followed by vitamin D. That is the reason, as human milk or breast milk is deficient in vitamin D, we have to provide it from outside. We have to give vitamin D supplementations to the infant till 1 year of age. And how much will be the dose? 400 international unit. Okay, that has to be given in the patient. If there is toxicity of vitamin D, बच्चों, definitely toxicity of vitamin D is known as hypervitaminosis D. Okay, and अगर hypervitaminosis D होगा बच्चों, तो serum calcium levels are known to rise. Definitely calcium की value बढ़ेगी. Serum calcium levels will increase, and due to that, definitely this extra calcium will deposit in various sites. Okay, that is called as metastatic calcification. Deposition of calcium at various sites or various organs is metastatic calcification. Okay, it will deposit inside the skin, and there will be chalky plaques inside the skin. Okay, chalk like plaques या patches दिखेंगे तुम्हें skin में. That is called as calcinosis cutis बच्चों. And second, it will deposit inside the blood vessel wall. As it will deposit inside the blood vessel wall, it will make the blood vessel wall harder, and that is the reason why the blood vessel wall will lose its elasticity, and that is the reason the patient will have hypertension बच्चों. ठीक है, so that's the important thing. What is the richest source of vitamin D? It is same as vitamin A. What is that? Halibut fish liver oil is the richest source of vitamin D as well. Does it have a plant source? No. So that's important. Vitamin D does not have a plant source, bachcho. That is the reason why in strict vegetarian or vegan patients, definitely, there are very high chances of vitamin D deficiency. Okay, there are very high chances of vitamin D deficiency. That you have to remember. No issues with this. Whereas if I talk about vitamin D deficiency, we know agar vitamin D कम हो जाएगा, तो serum calcium and serum phosphate के levels will fall. There will be decreased serum calcium and serum phosphate levels, due to which what is going to happen? Definitely, the parathyroid glands will be stimulated, due to which a lot of parath hormone will be secreted. And this parath hormone, bachcho, will activate the rate limiting enzyme of vitamin D synthesis known as 1-alpha hydroxylase, and that will lead to production of vitamin D3. Okay, so that will happen. Now, if there is deficiency of vitamin D in children, I have told you the child will develop rickets. Rickets is nothing but decreased mineralization of bone due to vitamin D deficiency. Here the bones will become much weaker. Therefore, there will be high chances of fracture. Okay, there will be craniotapes. What is craniotape? Softening of skull bones. There will be delayed closure of fontanelles. There will be delayed dentition. दांत लेट आएंगे बच्चे के, ठीक है? Delayed dentition. There will be beading of this costochondral junction known as rachitic rosary. Important is you have to remember that this rachitic rosary is usually painless, whereas corbitic rosary, which is seen in scurvy or vitamin C deficiency that we'll discuss today, it is very, very painful or it is tender on touch. ठीक है? Next important, the patient will have short stature क्योंकि height नहीं बढ़ेगी बच्चे की, क्योंकि bone की length नहीं बढ़ रही बच्चों. Next, the patient will have Harrison's groove or Harrison's sulcus. The patient will also have widening of wrist. That is a very characteristic and a very specific feature of rickets. तुम बच्चे का अगर wrist देखोगे, there will be widening of wrist in a child. That is suggestive of rickets in the child. ठीक है? X-ray अगर करेंगे wrist का, this is again a PYQ. A very characteristic features are seen. X-ray wrist पे definitely will see cupping, splaying, and fraying of metaphysis. Cup-like metaphysis is seen. Splaying is widened out metaphysis seen, and fraying is irregular margins will be seen. Okay, that's important. Whereas if I talk about deformities, yes, rickets can also lead to a lot of deformities. Please remember, it is the most common cause of genu varum in children. What is genu varum? Bowed knees. दोनों knee ऐसी है, ठीक है? So definitely that is called a genu varum, also known as bowed knees. उसका most common cause in children बच्चों is rickets itself. It can also lead to genu valgus. What is genu valgus? If both the knees are touching each other. ठीक है? Genu valgum or genu valgus is knock knees. If both the knees are touching each other, definitely. It can occur with rickets, but most common cause of genu valgum is not rickets. That you have to remember. Most common cause of genu valgum in children is not rickets. It is idiopathic, unknown cause. Most common cause of wind swept deformity. बच्चों wind swept deformity क्या होती है? एक टांग में genu valgus, दूसरी टांग में genu varum. Okay, so genu valgus in one leg and genu varum in another leg, definitely that is called as wind swept deformity, and it is the most common cause of wind swept deformity in children is rickets. Again, adults में you will study it is rheumatoid arthritis. ठीक है? That's important. Now, next we discussed was vitamin E. Definitely, vitamin E we know बच्चों that is the most potent lipid phase antioxidant. Rather, there are three vitamins which are acting as antioxidant. सबसे पहले antioxidant का काम क्या होता है? Understand. Please remember, जब सेल होगा तो सेल के अंदर खाना बनेगा. जैसे तुम किचन में खाना बनाते हो, तो किचन में खाना बनाते हो तो कचरा भी होता है ना, वैसे ही सेल के अंदर जब खाना बनता है तो उसके बाद कचरा प्रोड्यूस होता है. That कचरा which is formed inside the cell, that garbage is what is called as free radicals. These are oxygen free radicals, or we can call them reactive oxygen species बच्चों. To neutralize this, okay, अगर ये कचरा बाहर नहीं डालोगे घर से तो क्या हो जाएगा? बदबू मारेगा, डिसीजेस फैलाएगा. वैसे ही if you do not get rid of this toxic metabolites or these toxic free radicals or these reactive oxygen species from the cell, it will start damaging the cell. It can cause burst of the cell as well. ठीक है, तो दैट इज द रीजन व्हाई वी हैव टू न्यूट्रलाइज दीज फ्री रेडिकल्स. ओके, वी हैव टू फिनिश दिस फ्री रेडिकल्स. उनको फिनिश करने का काम बच्चों एंटीऑक्सीडेंट्स का होता है. ठीक है, तो एंटीऑक्सीडेंट समझ लो कचरे वाला होता है तुम्हारा. ठीक है, तो एंटीऑक्सीडेंट्स का होता है बच्चों. एंड देयर आर थ्री इंपॉर्टेंट विटामिन्स व्हिच एक्ट्स एज एंटीऑक्सीडेंट्स: विटामिन ए, विटामिन सी एंड विटामिन ई. एस इज द निमोनिक. ठीक है, इंपॉर्टेंट इज द मोस्ट पोटेंट. अगर तीनों में से पूछा जाए, इट हैज टू बी विटामिन ई. Okay, vitamin E is the most potent lipid phase antioxidant definitely, which is responsible for neutralization or scavenging of the oxygen free radicals, or we can call them reactive oxygen species. The most active form of vitamin E is known as alpha tocopherol bachcho. Okay, important question. Deficiency of vitamin E की वजह से क्या होगा? ये जो ऑक्सीजन फ्री रेडिकल्स है, जो कचरा बना था, will it get neutralized? No. So there will be more collection of oxygen free radicals inside various cells of the body, and that will lead to multiple manifestations in the patient. क्या होगा? Ophthalmoplegia होगा. Patient will not be able to move the eyes properly. Okay, that is ophthalmoplegia. Second, the patient will have ataxia. What is ataxia? Incoordination. Okay, so patient will have incoordination or ataxia in the body. And third, there will be hemolysis. What is hemolysis? RBC destruction. The RBCs will be destroyed बच्चों. ठीक है, because this extra oxygen free radicals will collect inside the RBC and the RBC will undergo oxidative burst. फट जाएगी वो कचरे की वजह से. ठीक है, so that's the important thing. Toxicity के least chances. We know fat soluble vitamins can lead to toxicity, but least chances among all fat soluble vitamins for toxicity are seen with vitamin E itself. Okay, sources of vitamin E, the most important or the richest source of vitamin E is the wheat germ seed oil, followed by cotton seed oil, followed by another nuts. Okay, treatment, it is used as a treatment for alopecia. We know ना vitamin E के capsules दिए जाते हैं बच्चों if there is hair fall or there is alopecia in a patient. ठीक है, so that's important. Last that we discussed in the last class was vitamin K बच्चों. vitamin K के तीन forms होता है: vitamin K1, K2 and K3. vitamin K1 बच्चों is known as phyloquinone. Phylo का मतलब ये होता है plants. So vitamin K1 of phyloquinone is derived from plants. Vitamin K2 is known as menaquinone. And menaquinone is synthesized in your own body. It is produced inside your own body. But by whom? By the intestinal bacterial flora. And third is vitamin K3, which is known as menadione. And this is synthetic form, जो बनाया जाता है laboratory में. That is menadione. Important, we know that vitamin K is a fat soluble vitamin, but there is only one form of vitamin K which is water soluble, and that has to be vitamin K3, that is menadione, the synthetic form. ठीक है? What is the function of vitamin K? Important question. Okay, PYQ है ये. It is responsible for activation of 4 clotting factors. Clotting factors का काम क्या होता है बच्चों? Clotting factors का काम होता है clot बनाना. And what will the clot lead to? Clot will stop the bleeding. ठीक है, so that's important. Please remember, vitamin K is responsible for 4 important activation of 4 important clotting factors. These are known as 2, 7, 9 and 10. कैसे याद रखना है? 2 plus 7 is equal to 9 and अगला वाला 10. So 2, 7, 9 and 10, these 4 clotting factors are activated by vitamin K. कैसे? Because carboxylation of these clotting factors at glutamic acid residues, it is done by vitamin K. Carboxylation, तोड़ते हैं इसको पहले. Carboxylation क्या होता है? Addition of carbon dioxide और एडिशन ऑफ कार्बन एटम इज कॉल्ड एज कार्बोक्सिलेशन. ठीक है, कहां पे बड़ा सा चेन होगा ना, तो कहां पे एग्जैक्टली? वेयर द ग्लूटामिक एसिड इज प्रेजेंट, एट दैट साइट इफ वी ऐड कार्बन एटम, दैट इज कॉल्ड एज कार्बोक्सिलेशन of these clotting factors at the glutamic acid residues. That leads to activation of these clotting factors बच्चों, जिसकी वजह से coagulation होगा. तो विटामिन के की वजह से coagulation हो रहा है. Okay, but if there is vitamin K deficiency, will coagulation occur? नो, कोएगुलेशन नहीं होगा. कोएगुलेशन नहीं होगा तो क्लॉट बनेगा? नहीं बनेगा. तो ब्लीडिंग बहुत ज्यादा होती है. ठीक है, so therefore deficiency of vitamin K बच्चों, it leads to multiple episodes of bleeding. There will be excessive or there will be massive bleeding. Okay, the patient can have recurrent epistaxis. What is epistaxis? Nose bleeds, नाक से खून बहता है. There will be recurrent episodes of epistaxis in the patient. और जब चोट लगती है, there will be excessive bleeding in the patient. There will be small bleeding spots बच्चों. Small bleeding spots are called as petechiae. Medium ones are called as purpura and large bleeding spots are called as ecchymosis. So petechiae, purpura, ecchymosis mentioned होगा केस में. ठीक है, so that has to be remembered. Important is, what did I tell you? The most deficient vitamin in human milk or breast milk बच्चों is vitamin K followed by vitamin D. हमने इसीलिए vitamin D के supplementations दिए थे till 1 year of age. इसीलिए हम vitamin K का भी एक injection देते हैं. Okay, at birth itself बच्चों, at birth itself we give a single intramuscular injection of vitamin K. The dose is 0.5 mg if the child is less than 1 kg birth weight, or it is 1 mg if the child is having more than 1 kg of birth weight. Why it is given? This was a previous year question again, PYQ. Vitamin K injection at birth is given to prevent hemorrhagic disease of newborn. It is क्योंकि vitamin K होगा ही नहीं breast milk में, So the child or the neonate can suffer from hemorrhagic disease of newborn. To prevent that, we give vitamin K injection at birth itself. ठीक है? And toxicity will lead to thrombosis. क्योंकि जब ज्यादा vitamin K होगा, ज्यादा clotting होगी, ज्यादा clots बनेंगे, therefore there will be increased risk of thrombosis if there is vitamin K excess in the body. ठीक है? So that's important. Now let's start with water soluble vitamins, shall we? Starting with vitamin B complex. Okay, first one among them will be your vitamin B1 बच्चों. ठीक है? So let's start now. ठीक है? First, if I talk about vitamin B1 बच्चों, recent question, कल का ही question आया हुआ है, so please be sure that vitamins are very important. Okay? So vitamin B1 बच्चों, it is also known as thiamine. Okay? So please remember vitamin B1, उसका दूसरा नाम है, it is also known as thiamine usually. What is the source of vitamin B1 or what is the source of this thiamine? Please remember, it is usually present in the allurone layer. Okay, it is usually present in the allurone layer of rice. What is this allurone layer बच्चों? ये जो बाहर वाली, I hope all of you have seen rice. Okay, so the brown layer that we have on outside or the yellow color covering that we have on the outside of the rice, definitely that is what is called as the allurone layer. Okay, so please remember that allurone layer is rich. That allurone layer is rich in thiamine or vitamin B1. ठीक है, but अगर हमने वो allurone layer हटा दी बच्चों, if we remove that allurone layer, what will happen? The patient will not get or the person will not get enough amount of vitamin B1. The patient will develop vitamin B1 or thiamine deficiency then. Which patients? जिनमें वो allurone layer rice की present नहीं होती. कौन से patients होते हैं ऐसे बच्चों? Polished rice eaters. Okay, so please remember that is the reason I'll talk about it जब मैं deficiency की बात कर रहा हूँ. ठीक है, तो please remember usually deficiency of vitamin B1 or thiamine will be seen in polished rice eaters क्योंकि please remember in polished rice definitely we do not have this allurone layer of rice and that is the reason why the patient is at a risk of developing deficiency. I know I've started it. Yeah, just a minute. I've started it again, don't worry, it is up here. ठीक है, चलो. So please remember, what is the active form of vitamin B1 बच्चों? The active form of thiamine or vitamin B1 is called as बच्चों TPP. What is TPP? Thiamine pyrophosphate. Okay. So please remember the active form of thiamine बच्चों is known as TPP. That is nothing else but thiamine pyrophosphate. That has to be remembered. The active form of vitamin B1 is TPP. No issues with this, anybody? Next, deficiency of vitamin B1. We know that deficiency of vitamin B1 will develop in two important individuals. One definitely will be your polished rice eaters. Second will be chronic alcoholic. Chronic alcoholic develops multiple vitamin deficiency in the body. ठीक है, क्योंकि अगर अल्कोहल पीता रहेगा definitely there will be deficiency or decreased absorption of multiple vitamins in the body. ठीक है, so that is the reason he will develop multiple ones. Among them, one of them is definitely vitamin B1 as well. ठीक है, so if I talk about deficiency will develop in polished rice eaters usually, in a normal individual or in a polished rice eater, if there is vitamin B1 or thiamine deficiency बच्चों, the disease that the patient develops, the disease or the condition that the patient develops बच्चों is known as beriberi. The disease or the condition that the patient develops due to thiamine or vitamin B1 deficiency, usually it is known as beriberi. Okay, so please remember it is known as beriberi. Hopefully it is not gone now. The screen is fine. ठीक है? Okay, it is known as beriberi usually. If I talk about beriberi बच्चों, beriberi is of two types. याद रखना, beriberi is generally of two types. First, if I talk about wet beriberi, okay, one is wet beriberi and second is dry beriberi. So why it is called as wet beriberi? Because in a case of wet beriberi, the patient will have edema. And why there is edema बच्चों? Due to congestive heart failure. So the patient of wet beriberi बच्चों develops a congestive heart failure and due to this congestive heart failure, अब बच्चों समझ लो, congestive heart failure, congestion का मतलब क्या होता है? बहुत ज्यादा fluid है body में तुम्हारी, ठीक है, इसकी वजह से तुम्हारा हार्ट पंप नहीं कर पा रहा. ओके, द हार्ट इज नॉट एबल टू पंप. दैट इज व्हाट इज द हार्ट हैज फेल्ड. दैट इज व्हाट इज कंजेस्टिव हार्ट फेलियर. Okay, due to extra volume inside the body, if the heart is not able to pump, that is a congestive heart failure. So here in wet beriberi, the patient develops congestive heart failure due to which अब ये blood पूरा का पूरा, there is a lot of blood which is there inside the vessels only, right? The blood pressure is too high and therefore that blood will go outside the vessel, and when blood goes or the fluid goes outside the vessel, there will be collection of fluid in between the tissue, and collection of fluid in between tissue is what is called as edema बच्चों. ठीक है, and that edema leads to swelling. ठीक है, तो याद रखना ये बात. No issues with this anybody? So wet beriberi में the patient develops congestive heart failure due to which there is edema. And the second one बच्चों is known as dry beriberi. In dry beriberi बच्चों the patient develops neurological manifestation. In dry beriberi the patient develops CNS or neurological manifestation. The patient can develop ataxia, the patient can have seizures, okay, the patient can develop confusion. So multiple manifestations like this, okay, will be developed in a case of dry beriberi. ठीक है, तो न्यूरोलॉजिकल मैनिफेस्टेशन होंगे तो उसको ड्राई बेरीबेरी बोलना है, बट अगर हार्ट के या सीवियस के मैनिफेस्टेशंस होंगे तो डेफिनेटली उसको वेट बेरीबेरी बोलना है. This is usually seen in polystriates or normal individuals who will develop vitamin B1 or thiamine deficiency. ठीक है, so that's important. Whereas if I talk about a chronic alcoholic बच्चों, in a chronic alcoholic vitamin B1 deficiency होगी, बट उसमें क्या होगा, फिर उसमें बेरीबेरी होगी क्या? हाँ हो सकती है, बट और एक चीज हो सकती है उस पेशेंट में, एंड दैट इज व्हाट इज कॉल्ड एज बच्चों वर्निकेज कॉर्सैकॉफ सिंड्रोम. ठीक है, तो दिस वाज अ पीवाईक्यू यस्टरडे. ठीक है, इसका केस दिया था. तो इंपॉर्टेंट इज वर्निकेज कॉर्सैकॉफ सिंड्रोम की बात करें, इट इज नथिंग बट थायमीन डेफिशिएंसी इन chronic alcoholics. Okay, it is thiamine or vitamin B1 deficiency बच्चों in chronic alcoholic patients. In chronic alcoholics, the patient is known to develop Wernicke-Korsakoff syndrome. In this Wernicke-Korsakoff syndrome, there are two features, Wernicke and Korsakoff. So let's see that. First thing that the patient develops, bachcho, the first thing that the patient develops is definitely the Wernicke's encephalopathy. Okay, in the initial phase of the disease, definitely the patient develops a Wernicke's encephalopathy. Important is that this Wernicke's encephalopathy बच्चों is characterized by a classical triad. This Wernicke's encephalopathy is characterized by a classical triad and that is known as GOA. ये important है, याद रखना बच्चों, क्योंकि यही mention था कल के केस में, right? So these three features will be present in a case of Wernicke's encephalopathy. What is encephalopathy? Damage to the brain. Due to that, the patient is known to develop these three features. GOA. G से क्या आता है? So please remember, from G you have to remember it as global confusion. What do I mean by global confusion? As the brain is damaged, the patient is confused. ठीक है, but global confusion मतलब the patient is confused in all domains. उसको कुछ समझ नहीं आ रहा. Okay, not only in one function, but in every function the patient is confused. उसको ना बोलना समझ में आ रहा है, उसको ना चलना समझ में आ रहा है. Okay, he is confused in everything. ठीक है, so that is what is called as global confusion. If the patient is confused in all functions, that is what is global confusion. Next, O stands for बच्चों, O stands for ophthalmoplegia. Okay, O stands for ophthalmoplegia. मैंने पहले ही बताया, ophthalmoplegia means paralysis of eyes. That means you are not able to move the eyes properly. That is called as ophthalmoplegia. ठीक है, and third A stands for ataxia. Ataxia भी बता दिया मैंने. Ataxia is nothing but इनकोऑर्डिनेशन ऑफ द बॉडी. ठीक है, इनकोऑर्डिनेशन. एंड जब अटैक्सिया होता है पेशेंट में, इनकोऑर्डिनेशन होता है. अटैक्सिया क्यों होता है? ड्यू टू डैमेज टू द सेरिबेलम. ओके, बिकॉज सेरिबेलम इज रिस्पांसिबल फॉर द बैलेंस ऑफ योर बॉडी. बट इफ सेरिबेलम इज डैमेज, दैट लीड्स टू अटैक्सिया और इनकोऑर्डिनेशन इन द पेशेंट और इम्बैलेंस इन द पेशेंट. ठीक है, तो पेशेंट अल्कोहलिक की तरह चलता है. ठीक है, द पेशेंट विल हैव अ सिजरिंग गेट और अल्कोहलिक की तरह चलेगा पेशेंट. ठीक है, कैट वॉक टाइप्स चलेगा. दैट इज व्हाट इज सीन इन अ केस ऑफ अटैक्सिया. नो इश्यूज विद दिस एनीबॉडी? So these are the three important classical triad of Wernicke's encephalopathy. Then, agar the patient develops severe deficiency of vitamin B1, then this Wernicke's encephalopathy bachcho will further progress into Korsakoff psychosis. This Wernicke's encephalopathy will further progress into Korsakoff psychosis. ठीक है, and जब Korsakoff psychosis होगा patient में बच्चों, in a case of Korsakoff psychosis, the patient will develop two important features. One, definitely the patient is known to develop dementia. What is dementia? Loss of memory. Okay, memory loss को बोला जाता है dementia बच्चों. ठीक है, so definitely in Korsakoff psychosis, the patient is known to develop dementia, that is loss of memory. Plus, along with that, the patient develops a very classical feature, and that was a previous year question again. And that classical feature बच्चों is known as confabulation. What is confabulation बच्चों? Important है, याद रखो. क्या होता है? तुम दारू पीने बैठे थे, डेफिनेटली यू हैड अ लॉट ऑफ ड्रिंक्स, नाउ यू आर हैविंग एमनेशिया. व्हाट इज एमनेशिया? अगेन लॉस ऑफ मेमोरी. एमनेशिया भी वो बोलते हैं उसको. ठीक है, तो यू आर हैविंग एमनेशिया. तुमने 3 पैग लगाए, उसके बाद तुम्हें कुछ याद नहीं आगे क्या हुआ. ओके, बट व्हेन यू आर टेलिंग द स्टोरी, उस दिन हम पीने बैठे थे तो ऐसा हुआ था. नाउ व्हेन यू आर टेलिंग द स्टोरी टू समवन, तुम्हें आगे कुछ याद नहीं है, बट तुम फॉल्स स्टोरीज बना रहे हो. ठीक है, तुम फॉल्स स्टोरीज बना रहे हो डेफिनेटली. ठीक है, इन केस ऑफ एंट्रोग्रेड. हाँ, एंट्रोग्रेड मतलब पीने के बाद कुछ याद नहीं रहता, पीने के पहले वाला याद रह जाता है. ठीक है, so anterograde, definitely anterograde amnesia is seen in cases of Korsakoff psychosis or in alcoholic patient. and therefore to cover up those memory gaps, तुम्हें याद नहीं है ना कुछ चीजें अभी क्या हुआ था, to cover up those memory gaps you will make a false stories. ठीक है, बस होशियारी मारने के लिए तुम कोई ना कोई false story बनाते हो. That is what is called as confabulation. Okay, so what is confabulation बच्चों, और ये mention किया गया था, that was the psychiatric question. Okay, to make up false stories to fill up the memory gaps, to make up false stories, to make up false stories to fill up the memory gaps, that is what is called as confabulation बच्चों. ठीक है, so that is what is known as confabulation. It is a feature of classical feature. That was a question where it is seen. So it is a classical feature. It is seen in a case of Korsakoff's psychosis. No issues till anybody. So please remember these two important things. ठीक है. Now important, if there is vitamin B1 deficiency or thiamine deficiency बच्चों in a patient, how do we assess it? कैसे assess करेंगे कि patient में vitamin B1 की deficiency है? So for assessment, we check the activity of one enzyme. क्यों? मैंने क्या बोला था? Water soluble vitamins, that is vitamin B complex and vitamin C. Their main function is they act as coenzymes. That means they will help enzymes for their activity or for their action. Therefore, your vitamin B1 or your thiamine also helps multiple enzymes in your body. One such enzyme is called as transketolase. This transketolase enzyme बच्चों is a part of the HMP pathway. What is HMP? We'll study that later. It is hexose monophosphate shunt. ठीक है, तो हेक्सोस मोनोफॉस्फेट शंट या एचएमपी पाथवे जो होता है बच्चों, उसमें एक एंजाइम होती है ट्रांसकीटोलेज. दैट ट्रांसकीटोलेज एंजाइम रिक्वायर्स विटामिन B1 फॉर इट्स एक्टिविटी. तो इफ इन अ पेशेंट वी आर हैविंग विटामिन B1 डेफिशिएंसी और देयर इज थायमिन डेफिशिएंसी, तो ट्रांसकीटोलेज काम कर पाएगी क्या? विल द ट्रांसकीटोलेज बी एबल टू वर्क? नो. सो द एक्टिविटी ऑफ द ट्रांसकीटोलेज विल go down. So that is what we have to check. ठीक है, so we will check for RBC transketolase activity. Again a previous year question, please remember, if the RBC transketolase activity is low, that means the patient is having vitamin B1 or thiamine deficiency. ठीक है, so that is a very important question repeated in NEET PG as well as FMG examination as well. So we are checking for assessment, we do RBC transketolase activity. We check the RBC transketolase activity. ठीक है, and that will be decreased in deficiency cases. ठीक है, no issues with this anybody? That is important to be remembered. Recent question it is. ठीक है, so that was all about your vitamin B1 बच्चों. Okay, known as thiamine. Second vitamin that we have to discuss from vitamin B complex बच्चों is known as vitamin B2. This vitamin B2 is also called as riboflavin. This vitamin B2 is known as riboflavin usually. ठीक है, the active form of vitamin B2 बच्चों, the active form of vitamin B2 or the active form of riboflavin, it is remembered as FMN or FAD. What is FMN? Flavin mononucleotide. So FMN is nothing but flavin mononucleotide. Or what is FAD? Flavin adenine dinucleotide. What is FAD? Flavin adenine dinucleotide. So these FMN and FAD are the active forms of vitamin B2 or riboflavin बच्चों. ठीक है, and what is their function? They are known to take up hydrogen. अब कोई रिएक्शन हो रही है बच्चों, फॉर एग्जांपल A is getting converted to B and in this reaction hydrogen is kicked out. Now there should be someone to take up that hydrogen ना बच्चों. So to take that hydrogen your FAD goes. Your FAD goes and takes that hydrogen and gets converted to FADH2. It gets converted to FADH2 and this FADH2 बच्चों will enter into a cycle that is called as ETC. Okay, it will enter into a electron transport chain. It will enter into a pathway known as electron transport chain and उससे क्या बनती है? ATPs बनती है. उससे क्या बनती है? ATP. That is your energy बनती है. ठीक है, so that has to be remembered. FADH2 when it enters into the ETC electron transport chain, it will lead to formation of ATP. That we'll discuss further, but just for your knowledge sake, I'm telling you कि याद रखना कि vitamin B2 का एक्टिव फॉर्म होता है FMN और FAD और FAD का काम होता है to take up hydrogen wherever it is kicked out from the reaction and then take it to the electron transport chain and leads to formation of ATP. ठीक है, important is if there is deficiency of vitamin B2 बच्चों, deficiency of vitamin B2 is what is called as A riboflavinosis. Easy है ना, याद रखना, A मतलब absence. So A riboflavinosis is nothing but vitamin B2 or riboflavin deficiency. In cases of A riboflavinosis बच्चों, there are three important features. There is the classical triad of A riboflavinosis again. These three important features which are seen in cases of A riboflavinosis. The first one that you have to remember is what is called as chelosis. What is chelosis? Inflammation of lips. Okay, so inflammation of lips is what is called as chelosis. Definitely, that will be the first feature. Second feature is what? The patient will develop atrophic glossitis. Okay, the patient will develop atrophic Glossitis. What is glossitis now? Itis तो हमें पता है. Itis is nothing but inflammation. Glossitis means मतलब inflammation of tongue. Okay. So atrophic glossitis is nothing but inflammation of the tongue which will develop. So initially patient will have a red beefy tongue. वो क्वेश्चन में मेंशन करेंगे रेड बीफी टंग और एकदम लाल लाल कलर की टंग दिखेगी. एंड दैट टंग बच्चों इज नोन एज मजेंटा टंग. दैट हैज बीन अ प्रीवियस क्वेश्चन नाउ. Magenta tongue is seen due to deficiency of. So we know that magenta tongue is seen due to deficiency of vitamin B2 or riboflavin. And further, what will happen? As I've told you, atrophic glossitis. That means further there will be atrophy. तो कुछ parts में atrophy होती है बच्चों. तो क्या दिखता है कि in tongue some parts are appearing red and some parts are appearing white or pale in color. Therefore, it appears something like this. Some parts are appearing red, some parts are appearing white. Right? Therefore, it appears like a map or geography. Therefore, this can also be called as, in later stages, the magenta tongue can progress and form a geographic tongue as well. Geographic tongue is also seen in vitamin B12 or cobalamin deficiency. Okay. Geographic tongue can also be seen in vitamin B12 or cobalamin deficiency, that we'll discuss later. But याद रखना vitamin B2 deficiency की वजह से भी geographic tongue होती है. Okay. Initially, there will be magenta tongue, but okay, red beefy tongue, that is a magenta tongue. And the third part of the triad, बच्चों, the third part of this A riboflavinosis का triad, you have to remember, it is nothing but angular stomatitis. What is stoma? Stoma का मतलब होता है mouth. It is inflammation. And angular, that means angles of mouth. Okay, you might have seen a lot of times, you will have inflammation over here. क्यों? That is suggested, that means you are having riboflavin deficiency in your body. ठीक है, तो याद रखना बच्चों, angular stomatitis means inflammation of the angles of mouth. Okay, so angular stomatitis is the part of triad, the third part of triad, and rather I will say that angular stomatitis is the most characteristic or most specific feature of A riboflavinosis. Angular stomatitis, out of the three, if they ask you which is the most characteristic or the most specific feature of A riboflavinosis, it has to be angular stomatitis, because chelosis and atrophic glossitis can also occur in other conditions, but angular stomatitis is very much specific to vitamin B2 or riboflavin deficiency known as A riboflavinosis. ठीक है, हो गया तीनों. So that's important. ठीक है, inflammation of lips, inflammation of tongue, and inflammation of angles of mouth. That is what is seen. Now, for this also we have a enzyme for assessment of vitamin B2 in the body. We also have an enzyme. That means we know vitamin B2 or riboflavin can also be used as a coenzyme, right? Therefore, अगर इसकी enzyme की activity check करेंगे, for example, this riboflavin is used by an enzyme known as glutathione reductase. So if we see that the activity of glutathione reductase is decreased inside the body, that is suggestive that the patient's body does not have, or it is deficient in vitamin B2 or riboflavin as well. Okay? So assessment बच्चों can be done with the help of RBC glutathione reductase activity. Okay? It can be done with the help of RBC glutathione reductase activity. RBC glutathione reductase activity. No issues with this, anybody? That has to be remembered. Okay, so that has to be remembered. Please remember, RBC transketolase activity was for vitamin B1 or thiamine. RBC glutathione reductase activity is checked for vitamin B2 deficiency. Okay, these are important questions from your previous year. बढ़िया आगे, that was all about your vitamin B2 बच्चों. Now let's discuss about your vitamin B3 जो सरकारी है but कल के एग्जाम में नहीं था. That's fine. अभी 4 बार से लगातार पूछ रहे थे, so they also got irritated with that question. ठीक है, but there was a question which could have confused. It was about zinc deficiency. Okay, so diarrhea and dermatitis उसमें भी होता है, and people got confused with vitamin B3 and therefore they marked it, but it was not the answer yesterday. ठीक है, so if I talk about vitamin B3 बच्चों, vitamin B3 is known as niacin. Okay, and vitamin B3 कल के एग्जाम में नहीं आया, but ये usually सरकारी क्वेश्चन है. सरकारी का मतलब multiple times repeated in your exam. ठीक है, so vitamin B3 is also known as niacin. Okay, that has to be remembered. Vitamin B3 is also known as niacin. We know that vitamin B3 or niacin is also an atypical vitamin. Why we are calling it an atypical vitamin? Because it is also a vitamin which can be produced inside your own body. We know that usually vitamins are not synthesized in our own body, but only 2 vitamins can be produced by our own body. One was definitely vitamin D and second is vitamin B3 known as niacin. किससे बनता है ये? So the synthesis of vitamin B3 बच्चों, the synthesis of vitamin B3 takes place from an amino acid. कौन सा amino acid? That is called as tryptophan. Please remember. Okay, that amino acid is known as tryptophan. So from 60 milligrams of tryptophan, 1 milligram of niacin is formed. From 60 milligrams of tryptophan, 1 milligram of niacin or vitamin B3 is formed usually inside your own body. Okay, and the enzyme which is responsible is known as, just remember, QPRTase. Okay, so the enzyme which is responsible is known as QPRTase. Okay, so please remember, enzyme responsible for this conversion is known as QPRTase. Okay, there is a very big pathway where tryptophan is converted into niacin. That you have to remember. Just remember the enzyme. That's it. No issues with this, anybody? Okay, so this was a question, from which amino acid it is derived from. We know it is derived from tryptophan itself. Okay, so if the patient is having deficiency of tryptophan, the patient will also develop deficiency of vitamin B3 or niacin. That has to be remembered. Okay, important is, if I talk about the active form of vitamin B3. So the active form of vitamin B3 bachcho is known as NAD or NADP. Okay, so it is known as NAD or NADP. What is NAD now again? NAD is nicotinamide adenine dinucleotide. What is NAD? Nicotinamide adenine dinucleotide. And what is NADP? Nicotinamide adenine dinucleotide phosphate. Okay, what is NADP? Nicotinamide adenine dinucleotide phosphate. Sorry. Okay, so that's important. That is what is NADP. दोनों का काम क्या होता है? Same as FAD. Same as FAD. That means, मैंने जैसे बोला, if A is getting converted to B and hydrogen is kicked out of the reaction, then definitely to take that hydrogen, who will come? Either it will be NAD or it will be NADP. इसमें याद रखना है, that's important now. NAD will be converted to NADH. NAD will be converted to NADH. And NADP will be converted to NADPH. NADP will be converted to NADPH. Important is, just like FAD was entering the electron transport chain, this NADH will also enter into the electron transport chain. And जब NADH will enter into the electron transport chain, it will also generate or it will also produce ATPs. ठीक है, तो इससे भी ATP production होगा. एक FADOH2 से, please remember, एक FADH2 से definitely 1.5 ATPs बनते बच्चों, but एक NADH से 2.5 ATPs बनते हैं. ठीक है, so that we'll discuss in ETC anyways, but just remember that for now. Next, NADPH बच्चों, NADPH will not enter into ETC. That has to be remembered, that NADPH जिसमें P आता है ना, वो definitely ETC cycle में participate नहीं करता है. As NADPH does not go inside the ETC, therefore it produces zero ATP. No ATPs are derived from NADPH. तुम बोलोगे फिर बना क्यों? वो बना इसलिए because it is known to donate hydrogen. Now कुछ reaction hydrogen को बाहर निकाल रही है body से, but there will be some reactions which will require hydrogen ना. So that hydrogen will be donated by NADPH. That is called as reductive biosynthesis. Right? Very good. ठीक है? That is known as reductive biosynthesis. For that purpose, जहां पे कोई चीज बन रही हो, synthesis हो रहा हो और उसमें हाइड्रोजन की जरूरत हो बच्चों, that hydrogen will be donated by your NADPH. ठीक है? So that's important. So भले ATP ना बन रही हो उससे, but important is it is used for donation of hydrogen usually. ठीक है? So that's important. I'm clarifying a lot of things over here. So when we are discussing the pathways, a lot of things will be clear already. Okay? So that's the reason. So the active form of vitamin B3, bachcho, niacin is NAD or NADP. That has to be remembered. Next important, if there is deficiency of vitamin B3 or niacin, what will the patient develop? First of all, किन patients में होती है vitamin B3 or niacin की deficiency? So vitamin B3 or niacin की deficiency, first of all, it is seen in maize eaters. Why it is seen in maize eaters, bachcho? Because maize is deficient in two amino acids. Maize actually is deficient in two amino acids. One is called as lysine and second is called as tryptophan. Ab samajh gaye? So as maize eaters will have tryptophan deficiency. That is the reason the patient will also develop vitamin B3 or niacin deficiency also. Okay? So that has to be remembered. Second patients are sorghum eaters. What is sorghum, bachcho? Sorghum is nothing but jawar. Because they contain an amino acid, and that amino acid, bachcho, is known as leucine. So these sorghum contains excess amount of leucine. So what is the problem with leucine? This leucine amino acid will stop the conversion. This leucine amino acid, bachcho, will stop the conversion of tryptophan into niacin. ट्रिप्टोफैन का जो नियासिन में कन्वर्जन होता है, that will be stopped by leucine. That will be stopped by leucine. That is the reason why there will be decreased production of niacin in the patient. There will be decreased production of niacin that will lead to deficiency. So therefore, important question that leucine is also known as pellagrogenic amino acid. याद रखना, पेलाग्रा किससे होता है? तो ल्यूसीन की वजह से होता है. पेलाग्रा किसकी डेफिशिएंसी की वजह से होता है? तो ट्रिप्टोफैन की डेफिशिएंसी की वजह से होता है. वापस रिपीट कर रहा हूं, pellagra is due to deficiency of which amino acid? Answer is tryptophan, because niacin is produced from tryptophan. Second, pellagra is due to presence of which amino acid? It is due to presence of leucine, because leucine stops conversion of tryptophan into niacin. Therefore, leucine can be called as pellagrogenic amino acid. It has to be called as pellagrogenic amino acid. No issues with this, anybody? That's important to be remembered. Okay? So that's the reason. Next important thing, definitely these patients will develop pellagra. Vitamin B3 deficiency is also known as pellagra now. That condition is what is called as pellagra. And this pellagra बच्चों पहले इसमें 3D थे, then there were 4D, now 5D, then 6D ultimately. ठीक है? So therefore, if they mention 3D disease, it is nothing but pellagra. 4D disease, pellagra. 5D disease, 6D disease. They're actually talking about pellagra only. ठीक है? So important. The first 3 D's which were there in cases of pellagra. The first 3 D's which were identified in a case of pellagra, okay? Sorry. The first D was diarrhea, okay? A patient of vitamin B3 deficiency, bachcho, develops diarrhea. The first D will be diarrhea. Second D will be dermatitis. Second D definitely is known as dermatitis. And dermatitis is what? Inflammation of skin. Okay, itis is inflammation, derma means skin. So dermatitis matlab inflammation of skin definitely. Okay, and here the patient will have dry skin, scaly skin usually on multiple aspects, but there is a very characteristic dermatitis over here. Kya hota hai? The patient has dermatitis around the neck. Okay, the patient has dermatitis around the neck, and therefore the patient develops dryness and scales usually around the neck. That looks like a necklace, and that is what is called as bachcho the classical around the neck pericervical dermatitis which is seen bachcho is known as Cahal's necklace or Casal's necklace, jo bhi tum bolna chaho. Okay, that is classically called as the Cahal's or the Casal's necklace in a case of vitamin B3 deficiency or pellagra. That is called as the Cahal's necklace. Okay. Next important bachcho, definitely the third D which was there. Okay, that third D is what is dementia. Okay, what is dementia? I've told you already, loss of memory. So the patient will also develop dementia. These were the first 3 Ds. Then the fourth D was added. Okay, what was that fourth D which was added? Please remember, the fourth D was death. So yes, if there was severe vitamin B3 deficiency, the patient also was the condition was also leading to death of the patient as well. Okay, the patient was dying out of that. Okay, then fifth and sixth D were added definitely. The fifth D you have to remember is called as delirium. Okay, the fifth D is delirium. What is delirium, bachcho? Clouding of consciousness. The patient is not entirely conscious. वो अपने होशो आवाज में नहीं होता. That is what is clouding of consciousness. Okay, he's not unconscious also. Okay, he's somewhere in between. He's not unconscious, he's not fully conscious. He's somewhere in between. That is called as clouding of consciousness. The patient appears to be confused. The patient is disoriented to time, place and person. मतलब मैं कौन हूँ, मैं कहाँ हूँ, मैं कहाँ से आया हूँ, all of that. ठीक है? So हिंदी वाला. Next. Important, delirium के बाद last one will be depression. The 6D which was added finally was depression. Okay, so that's important. So the classical 6Ds in a case of pellagra or vitamin B3 deficiency, bachcho, first one is diarrhea, second is dermatitis, third is dementia, fourth is death, fifth is delirium, sixth is depression. The dermatitis which is seen classically is known as the Cahal's or the Casal's necklace usually. Okay, so that has to be remembered. I've told you that usually water soluble vitamins, they do not lead to toxicity because they are excreted out by the kidneys. But there are 2 vitamins, water-soluble vitamins, which can have toxicity. One is vitamin B3 and second is vitamin B6, right? So if there is toxicity of vitamin B3, bachcho, if there is toxicity of vitamin B3, what will be the features in the patient? The patient will develop flushing. What is flushing, bachcho? Redness. Why does redness develop? Due to vasodilation. जब vessels dilate हो जाएंगी बच्चों, तो blood flow क्या होगा? बढ़ेगा या कम होगा? बढ़ेगा, right? So if the vessels dilate, the blood flow increases, therefore that causes flushing or that causes redness in that particular area. Okay, there will be flushing of face, and second, the patient will have pruritus. What is pruritus, bachcho? Excessive itching. The patient will have excessive itching or pruritus. That will be seen in the patient. Okay, so that has to be remembered. So flushing and pruritus are the most important symptoms in a case of vitamin B3 or niacin toxicity in a patient. Okay, important is that niacin is also used for treatment purposes. Where it is used for treatment purposes, bachcho? It is usually used for treatment purposes in a case of hyperlipidemia or dyslipidemia. ठीक है, if there is increased amount of lipids or inside the body of the patient, okay, so hyperlipidemia or dyslipidemia के cases में बच्चों it is used as a drug. Okay, important, it is an anti-hyperlipidemic or an anti-dyslipidemic drug usually. Okay, important is that please remember that we have two types of cholesterol in the body. One is called as good cholesterol, that is known as HDL, high density lipoprotein. Second is called as bad cholesterol, that is known as LDL, low density lipoprotein. ठीक है, तो usually please remember in dyslipidemia or in hyperlipidemia what happens, either there is increased levels of LDL, that is your bad cholesterol, or there is decreased level of HDL, that is your good cholesterol. तो niacin का काम क्या होता है? Please remember niacin is a drug which causes maximum increase. Okay, it has a maximum HDL increasing property. Okay, it has a maximum HDL increasing potential among all the anti-dyslipidemic drugs. बच्चों, maximum HDL increasing potential, if it is seen with some drug, that has to be niacin. ठीक है, so maximum HDL increasing potential or property is seen with niacin. Therefore, it is used if the patient is having decreased levels of HDL in the body. ठीक है, that is causing dyslipidemia. ठीक है, गुड कोलेस्ट्रॉल अगर कम होता है तो ये उसको बढ़ाने का काम करता है, गुड कोलेस्ट्रॉल को. ठीक है, so that's important. Next is vitamin B5 बच्चों, very like not very important things about this. So first of all, vitamin B5 का नाम क्या है? Vitamin B5 बच्चों is also known as pantothenic acid. Yes, vitamin B5 is known as pantothenic acid. And what is the role of this pantothenic acid or vitamin B5? So this vitamin B5 or pantothenic acid बच्चों, it has a coenzyme role. Okay, and it has a coenzyme role, or rather all water soluble vitamins we know they have a coenzyme role, but it acts as a coenzyme in the form of coenzyme A. Okay, so जहां जहां तुम्हें किसी भी सब्सटेंस में coenzyme A मिलेगा, that means वहां क्या यूज हुआ है, वहां पे विटामिन B5 या पैंटोथेनिक एसिड यूज हुआ है. ओके, a lot of times they say ना acyl coenzyme A, acetyl coenzyme A, so that coenzyme A which is there बच्चों, that is derived from the vitamin B5 or pantothenic acid itself. Okay, that coenzyme A is derived from vitamin B5 or pantothenic acid itself. तो याद रखना, जहां भी CoA आता है वहां पे कोएंजाइम का रोल कौन निभा रहा होता है, वहां पे कोएंजाइम का रोल निभाने का काम होता है विटामिन B5 या पैंटोथेनिक एसिड का. ठीक है, नो इश्यूज विद दिस एनीबॉडी. चलो, if there is deficiency of vitamin B5, deficiency of vitamin B5 बच्चों classically leads to a burning feet or burning soul syndrome. Okay, it will classically lead to burning feet or burning soul syndrome. So what happens in this patient? So please remember, due to deficiency of vitamin B5 or pantothenic acid, the patient develops a burning sensation in the sole of the feet. Okay, so जो तलवे होते हैं ना पैर के, in the sole of the feet the patient develops excessive burning sensation, due to which the patient is having a lot of pain or that burning sensation. That is what is called as burning feet or burning sole syndrome. Okay, so that is what is seen in a case of vitamin B5 deficiency. So that's only thing you have to remember. Only two things about this vitamin. Okay. Next important is vitamin B7 बच्चों. If I talk about vitamin B7 now, okay, hopefully you have written that. Now if I talk about vitamin B7, this vitamin B7 बच्चों is known as biotin. Okay, vitamin B7 is known as biotin. You might have heard this name as well. Okay, vitamin B7 is known as biotin, and the active form of vitamin B7, the active form of vitamin B7 is known as THB. What is THB? Tetrahydrobiopterin. Okay, so please remember the active form of vitamin B7 is known as tetrahydrobiopterin usually. That is the active form of vitamin B7. No issues with this anybody? That has to be remembered. Now this vitamin B7 or biotin, where it is actually required. So please remember, it is required in carboxylation reaction. मैंने पहले ही बोला, what is carboxylation? Addition of carbon is what is called as carboxylation. So that carboxylation reaction will be mediated by which enzymes? Carboxylases. And that carboxylase enzyme, बच्चों, wherever there is carboxylase in the body, that will require vitamin B7 or biotin as its coenzyme. ठीक है, so that has to be remembered. So याद रख लो. For example, if I am saying A is getting converted to B, okay, and here carbon has to be added. From where will that carbon come, bachcho? That carbon usually comes from CO2. Okay, that carbon is given from CO2 itself. Okay, so carbon is added in the reaction. Definitely carbon is added in the reaction. This reaction, bachcho, is known as carboxylation reaction, and it is mediated by carboxylases. These are the carboxylases enzyme. These carboxylases, bachcho, every carboxylase in the body requires three things, that is A, B, C. What is this ABC? Every carboxylase in the body requires ABC. What is ABC? A for ATP. Okay, every carboxylase requires ATP for addition of carbon. Then next, what is B? B is definitely biotin. That is your vitamin B7. Okay, it is required as a coenzyme for carboxylases. So B stands for biotin. And C, कहाँ से carbon आएगा? Carbon आएगा CO2 से. So that is CO2. Okay, so every carboxylase inside your own body, it will require three important things for its activity that are called as ABC. A for ATP, B for biotin, that is vitamin B7, and third is C for CO2. Okay, that is responsible for donation of carbon atom. ठीक है, चलो कोई दिक्कत नहीं यहां तक. Hopefully important is बच्चों, important is this vitamin B7 deficiency will be seen in a patient who is taking a lot of raw eggs, कच्चे अंडे जो खाता है. Okay, a patient or a person who is eating these raw eggs now, that person is at a high risk of developing vitamin B7 or biotin deficiency. Why? Because in these raw eggs, usually in these raw eggs we have a specific substance known as avidin. In these raw eggs, definitely we have a specific substance known as avidin, and that avidin inhibits the absorption of, that avidin actually inhibits, okay, or decreases, we can say. Okay, it inhibits the absorption of, it inhibits absorption of vitamin B7. It inhibits the absorption of biotin or vitamin B7. That is the reason why if a person is eating a lot of raw eggs, the patient is at a high risk of developing vitamin B7 deficiency or biotin deficiency. No issues with this. That protein has been asked in your board questions. Which protein inside egg, raw eggs, is responsible for biotin deficiency? Answer has to be avidin. Please remember. ठीक है, तुम बोलोगे फिर उबले हुए अंडों में नहीं, because when you boil the eggs, definitely this avidin will be denaturated, this protein will be broken down, it will be denaturated. That is the reason why in boiled eggs the patient will not develop biotin deficiency, but in raw eggs definitely the patient will develop biotin deficiency. Okay, so that's important. And if there is deficiency of biotin, please remember, no carboxylase in the body will be able to work. Okay, no carboxylase enzyme, क्योंकि पता है ना हमें carboxylase को काम करने के लिए तीन चीजों की जरूरत है, A, B, C. B for biotin. So definitely in deficiency of vitamin B7, the patient will develop multiple carboxylase deficiency. The patient will develop multiple carboxylase deficiency in the body. Okay, so that is what is seen. No issues with this, anybody? Multiple carboxylase deficiency is seen due to vitamin B7 or biotin deficiency. Okay, so that has to be remembered for your vitamin B7. Now let's talk about vitamin B6. If I talk about vitamin B6, बच्चों, this vitamin B6 is known as pyridoxine. This vitamin B6, बच्चों, is known as pyridoxine. The name of vitamin B6 is pyridoxine. What is the active form? What is the active form of this vitamin B6 or pyridoxine? So that has been in a previous year option. They did not mention pyridoxine or vitamin B6. Rather, they mentioned the name of active form and they just mentioned PLP. What is PLP? PLP is actually an active form of vitamin B6. What is that? That is pyridoxal phosphate. So please remember, PLP is nothing but pyridoxal phosphate, which is actually an active form of vitamin B6. Okay, so that has to be remembered. So option में कभी-कभी ये आ जाएगा. Don't get confused with that. What is the role of vitamin B6? We know all water-soluble vitamins, mainly vitamin B complex, are required as coenzymes, that is helping molecules for the main enzymes, right? So this also acts as a coenzyme for multiple enzymes in your body. So the role of vitamin B6 is also a coenzyme role itself, but for which enzymes in the body? So it acts as a coenzyme for enzymes like the transaminases, deaminases. That means it acts as coenzymes in the reactions like transamination. What is transamination, बच्चों? Trans is transfer, amination is amine group का transfer. NH2 group जो होता है ना, that is called as amine group. So transfer of amine group from one molecule to another molecule. Okay, that transamination reaction में what is required as a coenzyme? That is vitamin B6 or pyridoxine. Next, deamination. D मतलब निकालना. So amine group has been removed. So removal of amine group is called as deamination. उन reactions में भी vitamin B6 is required. ठीक है, transsulfuration. What is transsulfuration? Definitely transfer of sulfur group. So in transsulfuration reaction also we require vitamin B6. And last you have to remember simple decarboxylation. Okay, now we know what is decarboxylation. Carboxylation, if it is addition of carbon, decarboxylation will be removal of carbon. So decarboxylation is removal of carbon. This decarboxylation, bachcho, is of two types. One is called as oxidative decarboxylation and second is called as simple decarboxylation. So vitamin B6 is required for simple decarboxylation, whereas while oxidative decarboxylation के लिए we require vitamin B1, that is thiamine. Okay, that we'll talk about later, but in enzymes. But at least remember there are 4 enzymes or 4 main reactions in your body which definitely require vitamin B6 or pyridoxine as the cofactor. Coenzyme. Okay, no issues with this anybody? And this is trans, most important. That was a PYQ. That is the PYQ as transamination reaction requires which among the following molecules as a coenzyme? And in options they had PLP, as I've told you. That is pyridoxal phosphate. Okay, so that's important. No issues with this anybody? If there is deficiency of vitamin B6, what will the patient develop? If there is deficiency of vitamin B6, bacho, what will happen? Please remember vitamin B6 acts as a coenzyme for heme synthesis also. Okay, it acts as a coenzyme for all the enzymes of heme synthesis. जितनी भी enzymes होती है ना बच्चों heme synthesis की, उसमें vitamin B6 is required as a coenzyme. तो अगर vitamin B6 की deficiency होगी, तो heme synthesis हो पाएगा क्या? No. There will be no heme synthesis. As there will be no heme synthesis, what will be the patient develop? What will the patient develop? The patient is known to develop, बच्चों. The patient is known to develop microcytic hypochromic anemia. ठीक है? Important is there is another condition which can also lead to vitamin B6 deficiency, or it can lead to anemia due to the same reason, and that is known as lead poisoning. Yes, in cases of lead poisoning also, the enzymes of heme synthesis are inhibited, and that is the reason why the patient develops microcytic hypochromic anemia again in cases of lead poisoning. Okay, that was also PYQ in the yesterday's exam. Okay, तो याद रखने बात. तो lead poisoning और vitamin B6 deficiency दोनों का एक ही mechanism है. In both the conditions, the enzymes of the heme synthesis pathway will not work. That is the reason why there will be decreased production of heme, decreased production of hemoglobin, and that is the reason patient develops microcytic hypochromic anemia. Okay, the patient develops a microcytic hypochromic anemia usually. Okay, apart from that, definitely the patient is also known to develop peripheral neuropathy. Okay, the patient is also known to develop peripheral neuropathy. What is peripheral neuropathy? The patient will get numbness. Okay, जो nerves होती है ना वो काम नहीं करती, इसलिए in the peripheries, in the hands or feet, the patient will get numbness, tingling sensation, decreased sensation. ठीक है, so burning sensation, all of these. ठीक है, so burning sensation अगर बोलते हैं ना कि जलन मच रही है पैरों में, हाथों में, ठीक है, so that is what is due to vitamin deficiency in the body. And which vitamin mainly? It is vitamin B6. Okay, it can also be seen with vitamin B12, peripheral neuropathy, but commonly it is vitamin B6. ठीक है, तो peripheral neuropathy can be characterized by symptoms like numbness, tingling sensation. Okay, numbness, paresthesias. Paresthesias is decreased sensation, बच्चों. ठीक है, numbness, paresthesias, and tingling sensation. That is a characteristic feature in a case of neuropathy. Those will be seen in the patient. ठीक है, numbness, paresthesias, and tingling sensation. No issues with this anybody? That has to be remembered. And we know that deficiency of vitamin B6 will be seen in which patients? Deficiency of vitamin B6 is seen in 2 important patients. It is seen in either cases of lead poisoning. It is seen in cases of lead poisoning. And second, it is seen in patients who are taking isoniazid. Isoniazid is a first line anti-tubercular drug. So a patient who is on ATT, what is ATT? Anti-tubercular therapy. The patient who is on ATT, definitely on anti-tubercular therapy, is taking isoniazid, and that isoniazid is known to cause vitamin B6 deficiency in the patient, leading to peripheral neuropathy. That has been a very common and a previously asked question that has to be remembered. Okay? So they classically say a patient is a known case of tuberculosis. He started on anti-tubercular therapy, but now after a few weeks, the patient starts complaining of numbness, paresthesias, and tingling sensation in the extremities or in the peripheries. What is the likely diagnosis? So the likely diagnosis is nothing but vitamin B6 or pyridoxine deficiency. Another question, which drug is responsible for this? Answer is isoniazid is responsible for this. Okay? So that has to be remembered. No issues with this. Now to check the activity, to check the levels of vitamin B6 or pyridoxine in the body, we can check the activity of another enzyme. जैसे हम vitamin B1 के लिए RBC ट्रांसकीटोलेज की एक्टिविटी देख रहे थे, vitamin B2 के लिए ग्लूटाथायोन रिडक्टेज की एक्टिविटी देख रहे थे, वैसे ही for vitamin B6 or pyridoxine, we will see activity of transaminase. We will see activity of transaminase. That has to be remembered. No issues with this. We will check the activity of transaminase. Transaminase activity अगर कम होगी, that means the patient is having vitamin B6 or pyridoxine deficiency. No issues with this, anybody? So please remember this. ठीक है? Hopefully this is done. Now talking about the last two important vitamins in vitamin B complex, and these are very, very important. One is vitamin B9, that is your folic acid, and second is vitamin B12, that is cobalamin. And then we will be talking about vitamin C, and then we will be done with vitamins. Shall I? Chalo. If I talk about vitamin B9, bacho, if I talk about vitamin B9 is known as folate or folic acid. Please remember, vitamin B9 is known as folate or folic acid. 8 मतलब एसिड होता है, याद रखना. 8 जहां भी ऐड होता है ना, इसका मतलब उसको कार्बोक्सिलिक एसिड भी बोला जा सकता है. ठीक है? So folate or folic acid definitely is vitamin B9. What is the active form of vitamin B9? So you have to remember the active form of vitamin B9 has to be THF. That was a previous year question again. Tetrahydrofolate. Okay, so tetrahydrofolate is the active form of vitamin B9. That was a PYQ again. Okay, tetrahydrofolate is the active form of vitamin B9. No issues with this, anybody? That has to be remembered. That is the active form of vitamin B9. Important is when methyl tetrahydrofolate is converted to the active form, that is tetrahydrofolate. Okay, in this conversion, definitely in this conversion we require a vitamin, that is vitamin B12. Okay, so please remember, for conversion of methyl tetrahydrofolate to its active form tetrahydrofolate, we require vitamin B12. That means, ये समझ पा रहे हो, if there will be deficiency of vitamin B12, okay, this conversion will not occur, and that is the reason the patient will also develop deficiency of tetrahydrofolate, and that is the reason the patient of vitamin B12 deficiency a lot of times also develops a coexisting or a simultaneous deficiency of vitamin B9. ठीक है? तो हमने नॉर्मली पढ़ते हैं ना कि विटामिन B9 और विटामिन B12 की डेफिशिएंसी एक साथ होती है. क्यों? तो यही रीजन है, बिकॉज जिस पेशेंट में विटामिन B12 की डेफिशिएंसी होती है उसमें ये कन्वर्जन नहीं हो पाएगा. दैट इज द रीजन the patient will develop deficiency of vitamin B9 also simultaneously. ठीक है? So that has to be remembered. No issues with this, anybody? Now if I talk about deficiency of folic acid, okay, deficiency of folic acid, बच्चों. So deficiency of folic acid will lead to, first of all, which kind of anemia? Deficiency of folic acid will lead to megaloblastic anemia. Important is folic acid, बच्चों, या tetrahydrofolate. It is responsible for your DNA synthesis. It is responsible for the DNA synthesis. So that is the reason if there is folic acid deficiency, the DNA synthesis will be impaired or it will be affected. That is important to be remembered. Okay, so therefore the patient will develop a megaloblastic anemia. First thing, okay, the patient develops a megaloblastic anemia. What is seen in megaloblastic anemia? Hopefully all of you are quite aware. In cases of megaloblastic anemia, on peripheral blood smear, okay, in pathology you will study, but on peripheral blood smear, bachcho, you will see large size of RBC. That is called as macrovalocytes. Okay, so macrovalocytes are seen. These are nothing but large RBCs. Okay, apart from that, definitely you will see hypersegmented neutrophils. Okay, hypersegmented neutrophils will be seen. What is hypersegmented neutrophils? Normally neutrophils के न्यूक्लियस में कितने लोब होते हैं? Normally neutrophils के न्यूक्लियस में 3 से 5 लोब होते हैं. But if there is more than 5 lobe nucleus of neutrophil, that is called as a hypersegmented neutrophil. You will study that in pathology any which ways. So just remember, teardrop cells are also seen, but at least 2 important things that you have to remember is definitely macrovalocytes and hypersegmented neutrophils on the peripheral blood smear are seen in a case of megaloblastic anemia. That is how you will diagnose it. ठीक है बच्चों? Anemia के classical features होते हैं fatigue and pallor. Okay, fatigue and pallor. Fatigue is nothing but generalized weakness or malaise of the body. That is what is called as generalized weakness. So classical 2 signs of anemia is definitely fatigue and pallor. ये हमेशा होंगी. उसके साथ साथ अगर macrovalocytes से hypersegmented neutrophils दिख रहे हैं, that means it is a case of megaloblastic anemia due to which vitamin deficiency? Vitamin B9 or folic acid deficiency. Apart from that, if I say if a pregnant female, usually बच्चों, if a pregnant female develops deficiency of vitamin B9 during pregnancy, if there is deficiency of vitamin B9 during pregnancy in a pregnant female, तो क्या होगा? जो न्यूरल ट्यूब होता है वो ढंग से नहीं बन पाएगा. Okay, the neural tube will not be properly formed, and that is the reason the patient will develop neural tube defects. Deficiency of folic acid during pregnancy, बच्चों, will lead to neural tube defects in the fetus. Yes, it will lead to neural tube defects in the fetus. Examples of neural tube defect, for example, जब सर नहीं बनता, that is anencephaly. Okay, that is anencephaly. Or when there is a swelling on the back, that is called as spina bifida. Okay, so please remember, when there is a swelling on the back usually. Okay, so in all these conditions, these are the examples of neural tube defects definitely. Okay, so these neural tube defects will occur if there is deficiency of which vitamin during pregnancy? Deficiency of folic acid during pregnancy. Okay, important is that is the reason बच्चों in pregnancy whether the patient is having a deficiency or not, irrespective of that हमें फर्क नहीं पड़ता patient deficient है या नहीं है. Pregnancy में we have to give vitamin B9. We have to give vitamin B9 definitely. What is the recommended dietary allowance of vitamin B9? The recommended dietary allowance कितना देना चाहिए हर रोज? Okay, the recommended dietary allowance of vitamin B9 during pregnancy is 400 micrograms per day बच्चों. It is 400 micrograms per day. But in the iron folic acid tablets in India, in the IFA tablets, okay, we have iron folic acid tablets in India now, which are given to pregnant females or even lactating females. So in these iron folic acid tablets in India, bacho, the dose of folic acid which is present, okay, the amount of folic acid which is present, bacho, that is around 500 micrograms per day. Why? Because of patients, our Indian females are more deficient. Okay, so WHO bolta it is 400 micrograms. That is the recommended dietary allowance. But in Indian iron folic acid tablets, the dose which is present is 500 micrograms per day. Okay, no issues with this. 500 micrograms of folic acid in per tablet. No issues with this, anybody? That has to be remembered. But if they say if there is a high risk pregnancy, bacho, if there is a high risk pregnancy, what do I mean by high risk pregnancy? So high risk pregnancy का मतलब होता है either there is a previous history of neural tube defect. Okay, either there's a previous history of neural tube defect in the fetus or baby, पहली pregnancy में neural tube defect हुआ था बच्चे में, या फिर the patient is on anti-epileptic drug. Okay, the patient on anti-epileptic drugs like, okay, drugs like valproate. Okay, if the patient is on anti-epileptic drugs, something like valproate usually. So in these patients, definitely there are high chances the patient can develop folic acid deficiency. In these patients in high risk pregnancies, the dose of folic acid will be 10 times. It will be 4,000 micrograms, or we can call it 4 mg. Okay, the dose will be 4,000 micrograms or 4 milligrams. Okay, so that has to be remembered. In high risk pregnancies, the dose of folic acid will be 4,000 micrograms or 4 milligrams. No issues till anybody? So that has to be remembered, bacho. If I talk about assay, okay, how are you going to check for the levels of vitamin B9 or folic acid? Nowadays, we can easily check for the vitamin B9 levels directly in blood. Okay, so please remember to check for levels of vitamin B9. We can directly check the levels of serum vitamin B9 nowadays. Okay, so serum vitamin B9 levels can be checked. If that cannot be done, we can check for the levels of. Okay, we can check. Shall I? Okay. हाँ. So vitamin B9 की levels directly check करते हो बच्चों आजकल, या फिर हमें पहले टेस्ट करते थे. That what test was called as Figlu test. Nowadays it is not commonly done. That is known as Figlu test usually. Okay. So definitely याद रखना, Figlu test can also be done. Figlu is nothing but a metabolite of vitamin B9. अगर vitamin B9 कम होगा तो Figlu भी नहीं बनेगा. So definitely there will be decreased amount of Figlu in the patient's urine. That is what is called as a Figlu test usually. No issues with this, anybody? That has to be remembered. And third important that we check for is the homocysteine levels. क्यों? होमोसिस्टीन बच्चों एक टाइप का अमाइनो एसिड है. ये होमोसिस्टीन एक टाइप का अमाइनो एसिड है, और इस अमाइनो एसिड, ये जो अमाइनो एसिड है होमोसिस्टीन, ये बहुत टॉक्सिक है तुम्हारी बॉडी के लिए. Therefore this homocysteine, this toxic amino acid has to be converted into some another amino acid. This homocysteine has to be converted into this homocysteine has to be converted into methionine, because we know that homocysteine is toxic. अगर वो जमा होता रहेगा बॉडी में, तो the patient will develop a lot of diseases. That is the reason why this conversion has to be done. And for this conversion, we require two vitamins, bachcho. One is vitamin B9, that is folic acid, and second is vitamin B12, that is cobalamin. Important is, if the patient is having deficiency of vitamin B9 or B12, will this conversion occur? No. So if the patient is having deficiency of vitamin B9 or B12, conversion of homocysteine to methionine does not occur. That is the reason patient is known to develop increased levels of homocysteine. ये conversion नहीं होता, therefore homocysteine जमा होता रहेगा body, right? So we can also check for increased homocysteine levels in the blood. Okay, so in cases of vitamin B9 as well as vitamin B12 deficiency, there will be increased homocysteine levels, बच्चों. There will be increased homocysteine levels in the blood. There will be increased homocysteine levels in the blood. That has to be checked for. And okay, so these are the usual things. These are the three things definitely that we can do to check the levels of vitamin B9. Directly check the levels of vitamin B9, that is serum vitamin B9, Figlu test, or increased homocysteine levels. Important is Next, that is what is vitamin B12. Okay. Next one, that is vitamin B12 now. Okay. If I talk about vitamin B12, bachcho, vitamin B12 is known as cobalamin. Vitamin B12 is known as cobalamin usually. Okay. No issues with this, anybody? Vitamin B12 is known as cobalamin. Role iska bhi same hai. All B complex vitamins usually mainly has a coenzyme role itself. Most of the B complex vitamins has a coenzyme role. So here also vitamin B12 acts as a coenzyme for multiple enzymes in your body. Okay, for multiple enzymes in your body. Important is absorption. Important is your vitamin B12, bachcho. Vitamin B12 is generally absorbed from which part of the intestine? Your vitamin B12 is generally absorbed from the terminal ileum, the terminal part of your small intestine, that is terminal ileum. Important is vitamin B12, is it directly absorbed? No. So this vitamin B12, bachcho, forms a complex with another substance, and that substance is called as intrinsic factor of Castle. That substance is called as intrinsic factor of Castle. You're studying pathology or physiology. This intrinsic factor of Castle, it is actually secreted by the parietal or the oxyntic cells. Yes, the same cells which will secrete HCl also. Yes, the same cells are known to secrete intrinsic factor of Castle in the stomach. So vitamin B12 combines with the intrinsic factor of Castle, it forms a complex, and then finally it is absorbed at the level of terminal ileum. Okay? So the site of absorption, bachcho, site of absorption is definitely terminal ileum. Okay, terminal ileum definitely. And what is absorbed at the level of terminal ileum? Complex of, okay, complex of vitamin B12 and intrinsic factor of Castle. Okay, complex of vitamin B12 and intrinsic factor of Castle. No issues with this, anybody? That has to be remembered. That is absorbed at the level of terminal ileum now. So now let's discuss about deficiency of vitamin B12. If I talk about deficiency of vitamin B12, definitely what will the patient develop? Okay, so first of all, the patient will develop megaloblastic anemia, right? The same features, there will be macrovalocytes and hypersegmented neutrophils along with teardrop cells on the peripheral blood smear, just like folic acid deficiency, because vitamin B12 plus folic acid deficiency leads to megaloblastic anemia. Okay, it leads to megaloblastic anemia in the patient. Okay, no issues with this, anybody? So the patient can develop megaloblastic anemia. Next important, the patient will develop a severe form of neuropathy. First, the patient can develop a normal form of neuropathy that was seen in vitamin B6 deficiency also. क्या दिख रहा था vitamin B6 deficiency में? Peripheral neuropathy. So just like that, here also the patient can develop a peripheral neuropathy usually. ठीक है? In this peripheral neuropathy, definitely the patient will only have numbness, tingling sensation, and paresthesias. बस इतना ही होगा. ठीक है? So the patient can initially develop only peripheral neuropathy over here. The patient can only develop peripheral neuropathy. Okay, but if there is severe vitamin B12 deficiency, then the patient develops a severe form of neuropathy, bachcho, and that is what is called as SACT. What is SACT usually? SACT of spinal cord. SACT is nothing but subacute combined degeneration of spinal cord. It is nothing but subacute combined degeneration of spinal cord. Okay, that means here the spinal cord will be damaged or the spinal cord will be degenerated, bachcho. Okay, such severe type of neuropathy is developed due to vitamin B12 deficiency. Okay, so that has to be remembered. Important is this subacute combined degeneration of spinal cord. In this, which column of spinal cord is usually damaged or it is involved? So mainly, okay, mainly there is degeneration. Mainly there is degeneration of posterior or dorsal column of spinal cord. Okay, mainly there is degeneration of dorsal column, or you can call it posterior column of spinal cord. There is mainly degeneration of dorsal or posterior column of spinal cord. And I hope all of you might have studied from anatomy. Okay, if there is degeneration of dorsal or posterior column of spinal cord, bachcho, which functions are lost? We know that in dorsal or the posterior column of spinal cord, bachcho, only we have ascending tracts. Ascending tracts का मतलब वही चीज है बस जो sensation नीचे से ऊपर ले जा रही है, from spinal cord to brain, right? So in posterior column we only have ascending tracts or the sensory tracts usually. So their function is only carrying sensation. That is called as fasciculus cuneatus and fasciculus gracilis. These fasciculus or these bundles or these tracts will be damaged. So therefore there will be loss of some sensation. Which sensations are lost? So due to degeneration of dorsal or posterior column of spinal cord, bachcho, there will be loss of. Okay, so please remember there will be loss of fine touch. Yes, fine touch is lost. Then there is loss of vibration sense. Okay, there is loss of vibration sense. There is loss of proprioception, बच्चों. What is proprioception? Joint position. Okay, so loss of touch, fine touch बोलेंगे, loss of vibration sense बोलेंगे, loss of proprioception या joint position बोलेंगे. That means they are talking about damage to or degeneration of the dorsal or posterior column of spinal cord, and we know it is due to which vitamin deficiency? Vitamin B12. This has been a previous year question, बच्चों, and that's the reason why I'm telling you, because nowadays, as we know, questions even in paper 1 are not only one liners. They are most of the times clinicals. Okay, so therefore you have to be aware कि होगा क्या पेशेंट में. ठीक है, सैक्ट होता है, सैक्ट हमें पता है कि इससे होता है विटामिन B12 की डेफिशिएंसी से, बट वो ये थोड़ी पूछेंगे कि सैक्ट इज ड्यू टू डेफिशिएंसी ऑफ. दैट इज वेरी रेयर नाउअडेज. वो ये पूछेंगे कि द पेशेंट इज हैविंग लॉस ऑफ फाइन टच, वाइब्रेशन सेंस एंड प्रोप्रियोसेप्शन और जॉइंट पोजीशन. ओके, देयर इज डैमेज टू dorsal or the posterior column of spinal cord. It is due to which vitamin deficiency or what is the diagnosis? दोनों में से एक क्वेश्चन आएगा. ठीक है, so that has to be remembered. No issues with this, बच्चों. Please remember this. Apart from that, what did I tell you? Definitely, apart from this, definitely the patient will also have which kind of tongue? Geographic tongue. The patient will also have some red patches, some white patches on the tongue. That is called as a geographic tongue. So the patient will also develop geographic tongue. Along with that, the patient can also develop fissuring of tongue. Yes, fissures दिखेंगे तुम्हें, cracks दिखेंगे tongue पे. Okay, so this is a previous year question, December 2021. This was the image. Fissuring of tongue will be seen. Vitamin B12 is very important. 3 questions in December 2021 from the single vitamin. Okay, so there will be fissuring of tongue as well in vitamin B12 deficiency. Okay, so that will be seen. No issues with this. Apart from this, definitely talking about the last part, and the patient will also develop a pernicious anemia. Now, what is pernicious anemia usually? So please remember, in cases of vitamin B12 deficiency, the patients develop a classical pernicious anemia. What is the classical pernicious anemia? In this, it is seen in which patients usually? So the patient develops pernicious anemia. It is usually seen in patients of type A gastritis. What is type A gastritis, बच्चों? Type A gastritis is actually an autoimmune gastritis. What do we mean by autoimmune, बच्चों? Autoimmune का मतलब बॉडी में ऐसी कुछ एंटीबॉडीज बन जाती है जो खुद की बॉडी को या खुद के बॉडी के सेल्स को ही टारगेट करती है. ठीक है, देयर आर सम एंटीबॉडीज व्हिच आर फॉर्म्ड इन योर बॉडी व्हिच आर टारगेटिंग योर ओन बॉडी सेल्स और योर ओन बॉडी ऑर्गन्स. ठीक है, सो दैट इज व्हाट इज ऑटोइम्यून. सो टाइप ए गैस्ट्राइटिस, व्हाट इज गैस्ट्राइटिस? इन्फ्लेमेशन ऑफ स्टमक और डैमेज टू द स्टमक. ठीक है, टाइप ए गैस्ट्राइटिस इज ऑटोइम्यून गैस्ट्राइटिस वेयर देयर आर ऑटो एंटीबॉडीज which will target the parietal or the oxyntic cells of stomach. Okay, एक ही cells होते हैं, उसी के 2 नाम है. Parietal or the oxyntic cells of stomach, they are targeted by these autoantibodies. And as they are damaged by these autoantibodies, definitely, that is the reason what will happen. The 2 things which are secreted by parietal or oxyntic cells of stomach, definitely, they will be decreased. One is definitely there will be decrease in HCl. Okay, these are known to secrete HCl now. There will be decrease in HCl levels. That is, there will be hypochlorhydria or there will be achlorhydria. Okay, there will be decreased HCl levels. And second, there will be decreased levels of intrinsic factor of Castle, bachcho. There will be decreased levels of intrinsic factor of Castle. As there is decreased levels of intrinsic factor of Castle, bachcho, the patient develops deficiency of vitamin B12. क्यों? क्योंकि हमें पता है that the intrinsic factor of Castle forms a complex with vitamin B12 and that leads to absorption of vitamin B12. But अगर patient की body में intrinsic factor of Castle ही नहीं होगा तो vitamin B12 का absorption हो सकता है क्या? नहीं होगा. That is the reason the patient develops vitamin B12 deficiency. Okay, and that leads to a classical anemia in the patient that is called as pernicious anemia in the case of type A or autoimmune gastritis. Okay, so that has to be remembered. Along with that, HCl की कमी होती है ना बच्चों, that is the reason patient also develops iron deficiency anemia. क्यों? Because for absorption of iron, we require an acidic medium. Iron requires acidic medium. Iron is absorbed from the duodenum mainly. Mainly iron is absorbed from the duodenum. We'll talk about iron. Iron is mainly absorbed from duodenum and it requires acidic medium for its absorption. Okay, so that is the reason यहाँ पे acidic medium है ही नहीं because there is low levels of HCl in the stomach. That is the reason the patient will have iron deficiency leading to iron deficiency anemia as well in the same patient of type A or autoimmune gastritis. No issues with this, anybody? That was everything about the features of vitamin B12 or cobalamin deficiency, बच्चों. ठीक है. If I talk about assessment बच्चों now, if I talk about assessment, how you can assess, assessment की अगर मैं बात करूं तो please remember vitamin B12 deficiency can be assessed by directly checking the levels of vitamin B12 itself. Yes, nowadays we can check the levels of vitamin B12 directly in the serum or in the blood. So by checking serum vitamin B12 levels in the blood, that can be done. Or previously, to check for malabsorption of vitamin B12, you used to perform a bacterial test, and that bacterial test was called as the Schilling's test, बच्चों. Okay, so that was called as the Schilling's test. आजकल नहीं करते हैं. Schilling's test was done to check malabsorption of vitamin B12. Okay, it was done to check the malabsorption of vitamin B12. इंट्रिंसिक फैक्टर ऑफ कासल अगर डेफिशिएंट होगा तो उसकी वजह से विटामिन B12 का कॉम्प्लेक्स नहीं बन पाएगा, और जब तक ये कॉम्प्लेक्स नहीं बनता तब तक विटामिन B12 अब्सॉर्ब नहीं हो सकता फ्रॉम द टर्मिनल आइरियम. दैट इज द रीजन व्हाई द पेशेंट डेवलप्स डेफिशिएंसी ऑफ विटामिन B12 यूजुअली. ठीक है, सो दैट हैज टू बी रिमेंबर्ड. So first we can check the levels of serum vitamin B12. Second, we can perform a Schilling's test, which is a bacterial test done to assess or to check malabsorption of vitamin B12. Third important, we can check for homocysteine levels. We will see there will be increased homocysteine levels. हमने बोला था ना कि homocysteine levels will be elevated in both the condition, because homocysteine to methionine, this conversion requires vitamin B9 as well as vitamin B12. Okay, that is the reason why homocysteine levels will be elevated in B9 as well as B12 deficiency. तो यहाँ भी homocysteine के levels बढ़े हुए होंगे. तुम बोलोगे सर अगर दोनों में homocysteine के levels बढ़े हुए हैं, if they only mention if the patient is having increased homocysteine levels, okay, so please remember increased homocysteine levels cannot make a diagnosis or a difference between vitamin B9 and vitamin B12 deficiency. In that condition, अगर वो बस बोलते हैं that the patient is having pallor and fatigue, that means the patient is having a megaloblastic anemia, okay, and there will be increased homocysteine levels. And now what should be given for treatment? Please remember, बस homocysteine levels अगर बढ़े हुए mention किए उन्होंने in a case of megaloblastic anemia, please mark vitamin B9 as well as vitamin B12 for treatment. The reason is, if you're not sure whether it is vitamin B9 or vitamin B12 deficiency, then it is better to give both the drugs. Then it is better to give both the vitamins, B9 plus B12. Reason is, if you only give vitamin B9 or folic acid to the patient, what is going to happen is, अगर तुम बस folic acid देते हो supplementation, the patient's hematological symptoms will improve. मतलब जो anemia है patient का वो improve हो जाएगा, but his neurological symptoms will worsen. The patient might have vitamin B12 deficiency also. His anemia symptoms are improving, but his neurological symptoms are worsening. He might develop a subacute combined degeneration of spinal cord also. Okay, so for that reason, if you're not sure, they have only mentioned increased homocysteine levels, please mark both in the option vitamin B9 plus vitamin B12. ठीक है? So to differentiate, do we have a test? Yes, we do. Okay, तो याद रखना, here definitely your methyl malonic acid MMA is degraded usually. Your methyl malonic acid is usually degraded into its metabolite, and for this degradation, बच्चों, we require vitamin B12. For this degradation of methyl malonic acid or methyl malonate, we require vitamin B12. But if there is deficiency of vitamin B12, will this conversion occur? No. Methyl malonic acid or methyl malonate will not be degraded. Therefore, there will be increased levels of methyl malonic acid in the blood. Okay. So, along with increased homocysteine levels, if they are also mentioning there is increased methyl malonic acid levels, if they are also mentioning if there are increased methyl malonate or malonic acid levels, definitely that is suggestive of vitamin B12 deficiency. So this is what is characteristic. ये याद रखना है, ठीक है. इंक्रीज होमोसिस्टीन लेवल्स दिया है तो वी आर नॉट श्योर, दोनों हो सकता है. बट अगर इंक्रीज मिथाइल मैलोनेट लेवल्स दिया है तो डेफिनेटली दैट मींस इट इज विटामिन B12 deficiency. This was a previous year question where there was a classical case of megaloblastic anemia. They said that on peripheral blood smear we have macrovalocytes and hypersegmented neutrophils. Then they said there is increased homocysteine levels. Till this दोनों भी possible थे. But then in the next line they said that methyl malonate or methyl malonic acid levels are normal. So if methyl malonic acid levels are normal, that is vitamin B9 deficiency, and if methyl malonic acid or methyl malonate levels are increased, that is what is vitamin B12 or cobalamin deficiency. Got it बच्चों? So that has to be remembered. That will help you make a difference between B9 and B12. नहीं पता difference, better to mark both B9 plus B12. ठीक है? तो याद रखना है बात. ठीक है? तो important is please remember, if not sure, about, if not sure about B9 or B12 deficiency, not sure about B9 or B12 deficiency, give both vitamins. Give both vitamins to the patient. Okay. Otherwise, I've told you there will be improvement in hematological symptoms or anemia, but worsening of the neurological symptoms. ठीक है? Important is बच्चों याद रखना that cobalamin or vitamin B12, your cobalamin or vitamin B12 is also used as a drug of choice somewhere. Yes, it also has a treatment purpose. It is used as a drug of choice for cyanide poisoning. Please remember, this was a previous year question. For cyanide poisoning, okay, for cyanide poisoning, definitely the drug of choice has to be vitamin B12 or cobalamin. PYQ है तुम्हारे, ठीक है? No issues with this, anybody? That has to be remembered. Talking about the last vitamin, then we'll take a break before starting minerals. ठीक है? Talking about the last vitamin now, and that last vitamin is your vitamin C. Okay, are you able to cope up, everyone? No issues. समझ में आ रही है चीजें? If you're having any doubt, you can ask me at any point of time. Always welcome. ठीक है? Next is vitamin C, बच्चों. Let's start talking about vitamin C usually. If I talk about vitamin C बच्चों is also known as ascorbic acid, या फिर मैंने बोला था ना acid जहां होगा वो ascorbate भी बोल सकते हो उसको, ठीक है? So please remember, vitamin C is also known as ascorbic acid or ascorbate. Okay, it is known as ascorbic acid or ascorbate usually, ठीक है? What is the source of vitamin C? तो याद रखना है, the richest source. Okay, this was a previous year question. The richest source of vitamin C, you have to remember, it is Indian gooseberry. What is Indian gooseberry? आंवला. जो तुम्हारा आंवला होता है ना, that is the richest source of vitamin C. Okay, COVID में सबने खाना शुरू किया था. Okay, why? Because vitamin C is known to increase immunity. It, okay, improves your immunity. That is the reason. ठीक है? So please remember, the richest source of vitamin C is nothing but your Indian gooseberry. That is nothing else but your amla, definitely, and that is known to strengthen your immunity. We will talk about that. ठीक है? No issues with this, anybody? Understood? So that's important. Apart from this, if I talk about other sources also, okay, other sources usually you have to remember, it is sorry, apart from Indian gooseberry, it can be citrus fruits. Citrus matlab khatte fruits. Okay, anything which is citrusy or anything which is khatta. Okay, all the citrus fruits, that is your orange, lemons, okay, lime, orange, lemon, lime, all of these are citrus fruits which are known to increase the vitamin C levels usually. Okay, apart from that, if they ask you about a vegetable source, bachcho, if they ask you about a vegetable source, so vegetable source of vitamin C, you have to remember, it is cabbage. Yes, vegetable source of vitamin C is cabbage, patta gobi. Okay, whereas if they ask you a non-citrus fruit, if they ask you a non-citrus fruit which is a rich source of vitamin C, a non-citrus fruit which is a rich source of vitamin C, then your answer has to be guava. Okay, then your answer has to be guava, amrud. Okay, so that's important. Okay, now richest source of vitamin C, Indian gooseberry or amla. Apart from that, citrusy fruits, but non-citrus fruit का पूछे तो guava, and vegetable source का पूछे then it has to be cabbage. No issues with this, anybody? Important is now, what is the role of vitamin C usually? We know now there are 3 vitamins which are acting as antioxidant. One of that vitamin is vitamin C. A, C, E, 3 थे ना? So definitely second vitamin which is acting as an antioxidant, it has an antioxidant role. Antioxidant का मतलब क्या होता है? मैंने पहले ही बोला, कचरे वाला. Antioxidant का मतलब all that garbage or the free radicals which are formed inside the cell, they will be neutralized, they will be nullified, they will be scavenged out. Okay, so neutralization of free radicals will be done by vitamin C because it has an antioxidant role, बच्चों. ठीक है? Apart from that, I've told you definitely it is also responsible for wound healing. Okay, it is also responsible for wound healing and repair. Vitamin C is also responsible for wound healing and repair. Apart from that, okay, apart from that, you have to remember, for wound healing and repair also it is responsible. It is also known to improve immunity or strengthen immunity. It is also known to strengthen the immunity of the patient. It is also known to strengthen the immunity of the patient. Okay? And last important one, and the most important one rather, it is also responsible for collagen synthesis. It is also responsible for collagen synthesis. We know that the most abundant protein inside your body, okay, maximum amount of कौन सा protein present है body में? Collagen. हर जगह collagen है. There are various types of collagen, but the most abundant protein inside your body is collagen, definitely, right? So skin, tendon, bone, ligament, cartilage, blood vessel, valve, everywhere we have collagen, some or the other type. So for that collagen synthesis बच्चों vitamin C is required definitely. कैसे? Because please remember vitamin C, okay, vitamin C acts as a coenzyme. Vitamin C acts as a coenzyme. Okay, I've told you, water soluble vitamins acts as coenzymes. So here vitamin C acts as a coenzyme for lysyl hydroxylase. Okay, for an enzyme known as lysyl hydroxylase. Okay, which is the first enzyme of your collagen synthesis. Which is the first enzyme of your collagen synthesis. याद रखना बच्चों, कोलेजन का जो स्ट्रक्चर होता है वो ऐसा होता है, हम बाद में देखेंगे, बट जस्ट बता रहा हूँ. ग्लाइसिन एक्स वाई मतलब हर तीसरा अमाइनो एसिड जो होता है ना वो ग्लाइसिन होता है. ओके, बट ये एक्स और वाई क्या होता है? ये एक्स और वाई होते हैं यूजुअली हाइड्रोक्सी प्रोलीन या हाइड्रोक्सी लाइसिन. ओके, ये एक्स और वाई क्या होते हैं? हाइड्रोक्सी प्रोलीन या हाइड्रोक्सी लाइसिन. तो नॉर्मल जो प्रोलीन होता है इट इज कन्वर्टेड टू हाइड्रोक्सी प्रोलीन, या नॉर्मल जो लाइसिन होता है इट इज कन्वर्टेड टू हाइड्रोक्सी लाइसिन. और ये हाइड्रोक्सिलेशन रिएक्शन जो होती है ना, इट इज मीडिएटेड बाय लाइसाइल हाइड्रोक्सिलेज. दिस हाइड्रोक्सिलेशन रिएक्शन इज मीडिएटेड बाय लाइसाइल हाइड्रोक्सिलेज. एंड इसको कौन मदद करता है? इसको मदद करने का काम तुम्हारा विटामिन सी या एस्कॉर्बिक एसिड करता है. समझ गए? So that's the reason. Please remember collagen synthesis में कैसे काम करता है? It is actually a coenzyme required for lysyl hydroxylase enzyme, which is responsible for hydroxylation of proline and lysine into hydroxyproline and hydroxylysine, which are the components of collagen structure itself. ठीक है? So that has to be remembered. अगर विटामिन सी नहीं होगा बॉडी में तो क्या होगा? लाइसाइल हाइड्रोक्सिलेज काम कर पाएगा क्या? नो. द एक्टिविटी ऑफ लाइसाइल हाइड्रोक्सिलेज विल डिक्रीज and therefore collagen synthesis ढंग से हो पाएगा क्या? नहीं. That's the reason why there is decreased collagen synthesis if there is vitamin C deficiency in the body बच्चों. ठीक है? So that has to be remembered. So deficiency of vitamin C now. Deficiency of vitamin C definitely it is known as scurvy. Deficiency of vitamin C is known as scurvy. Scurvy was first identified in sailors. Okay? स्कर्वी सबसे पहले पता लगी थी ना, वो सेलर्स में पता लगी थी. सेलर्स मतलब कौन? जो शिप पे रहते हैं बहुत टाइम. ठीक है? मर्चेंट नेवी वाले फॉर एग्जांपल, लाइक दैट. ओके, सो यूजुअली इट वाज आइडेंटिफाइड इन सेलर्स एंड इट वाज आइडेंटिफाइड बाय अ पर्सन नोन एज जेम्स लिंड. सो ही वाज द फर्स्ट वन टू आइडेंटिफाई स्कर्वी एंड दैट वाज अ पीवाईक्यू, इसलिए बता रहा हूं मैं. ठीक है? सो प्लीज रिमेंबर जेम्स लिंड वाज द फर्स्ट पर्सन हु आइडेंटिफाइड स्कर्वी इन सेलर्स यूजुअली हु यूज्ड टू बी ऑन शिप्स फॉर लॉन्गर ड्यूरेशन ऑफ टाइम. तो इनको फ्रेश फ्रूट्स वगैरह नहीं मिलते थे. ठीक है? So that is the reason why they were usually developing scurvy. Important is, याद रखना, if you make juice, okay, usually, or if you boil these fruits, definitely the proteins, the vitamin C or the ascorbic acid which is there, it will be denaturated. So it's better to always eat these fruits in the natural form itself. Okay, in the natural form itself, then only they will increase the levels of vitamin C in the body. Okay, not in the synthetic form. ठीक है? तो याद रखना है बात. Important is definitely if I talk about scurvy, what will be the features in a case of scurvy? So very characteristic feature in a case of scurvy is what is gum bleeding बच्चों. क्यों gum bleeding होगी? अब definitely in a patient of scurvy there will be decreased collagen synthesis. The patient will have a decreased collagen synthesis, and we know that this collagen is present everywhere. It is present everywhere in every membrane, in every wall of the body. It is present. Blood vessel की wall में भी होगा ना. So definitely if collagen synthesis से कम हो गया तो जो blood vessel की wall बनेगी अभी वो बहुत weak बनेगी. Therefore these blood vessel walls will rupture. These blood vessels will rupture easily, and that is the reason why the patient will have bleeding at multiple sites. One of those sites is also the gums usually. So that is a very classical and a characteristic feature. Due to decreased collagen synthesis, there will be weakness of the blood vessels, and these blood vessels, weak blood vessels, will rupture on a recurrent basis, and that is known to cause gum bleeding बच्चों. Okay, so very characteristic of vitamin C deficiency or scurvy, that is gum bleeding in the patient. ठीक है? So gum bleeding होगा. उसके अलावा if the skin vessels will rupture, तो small bleeding spots will be seen as well, and these small bleeding spots definitely on the skin, we know it is called as petechiae. So bleeding and petechiae are features of vitamin K as well as vitamin C deficiency. दोनों याद रखना है. ठीक है? So petechiae भी दिखेंगे patient में. Apart from that, what will happen? Please remember, collagen is also present in the hair, and as there is vitamin C deficiency, therefore collagen synthesis is decreased. Therefore, the hairs which will be formed, they will also not be very strong. Okay, so the patient will have brittle. What is brittle? Easily breakable. The patient will have brittle or weak hair usually. Okay, the patient will have brittle hair. That means easily टूट जाएंगे. बच्चे के बाल जो है वो easily टूट जाएंगे. Easily breakable or very fragile and brittle hair will be there in the child. Apart from that, there will be high chances of bleeding everywhere. Na? Every blood vessel wall is weak. Therefore, there will be high chances of bleeding between the bone and its covering. Bone is called as ostium. Covering is called as periosteum. तो पेरियोस्टियम के नीचे there will be hemorrhage, that is called as a subperiosteal hemorrhage बच्चों. Now ये subperiosteal hemorrhage कहाँ होता है? long bones में mainly. कहाँ पे? lower limbs में, legs में. अब now if there is a subperiosteal hemorrhage बच्चों, what is going to happen is definitely there is collection of blood, okay, in the around the muscle definitely, and that is causing a lot of pain in the child. Okay, that will cause a lot of pain in the lower limbs of the child. That is the reason the child is not able to stand up or the child is not able to walk. Due to that excessive pain, the child is not able to stand up or walk, and that is what is called as pseudo paralysis. Why pseudo paralysis? बच्चा चल नहीं पा रहा इसलिए paralysis. Pseudo क्यों? Because is the child having any muscle problem? No. Is the child having any nerve problem? No. So then also there is paralysis. So that's the reason there is pseudo paralysis. Muscles are strong, nerve is absolutely perfect. The only problem is as there is a lot of pain, the child is not able to walk. Okay? So that is what is called as pseudo paralysis बच्चों. Pseudo paralysis of calf. Okay? Pseudo paralysis of calf is usually seen, and that is due to subperiosteal hemorrhages. That is due to subperiosteal hemorrhages. No issues with this, anybody? That has to be remembered. ठीक है? Okay, so that has to be remembered. Please remember these are the important features that you need to remember. Gum bleeding होगा, petechiae होगा, brittle या easily breakable hairs होंगे बच्चे में. Pseudo paralysis of calf होगा, that is nothing but subperiosteal hemorrhages, and due to that definitely it is excessively painful. Okay, painful limp होगा बच्चे में. Child will walk, or if he tries to walk, there will be excessive pain. There will be painful limp in the child due to that. Okay. Apart from that, definitely, the child will also have bleeding of the costochondral junction. This bleeding of costochondral junction is known as rosary, because it gives rosary bead-like appearance. Na? Swelling of these costochondral junction. Kyun? Okay, this swelling of costochondral junction is again due to bleeding. यहाँ पे भी bleeding होगी. Therefore, there will be a lot of swelling over here. Okay, so bead-like fashion, there will be swelling over here. That is called as scorbutic rosary. Now, in rickets also it was seen, na? In ricket, it was rachitic rosary, but in cases of scurvy or vitamin C deficiency, bachcho, it will be called as scorbutic rosary. And this scorbutic rosary, important, as I've told you, it is due to bleeding at the costochondral junction. It is due to bleed at costochondral junctions usually, and as there is bleeding at the costochondral junction, this will be painful or painless. This will be very, very, very painful. Okay, this will be sharp, this will be angulated, and this will be very, very painful or tender. तो पेनफुल या टेंडर कुछ ना कुछ तो मेंशन करेंगे. ओके, जैसे ही तुम बच्चे को यहां से पकड़ने की कोशिश करते हो, द चाइल्ड क्राइज आउट इन पेन, क्योंकि बहुत ज्यादा दर्द होता है. ठीक है, सो दैट इज द रीजन. प्लीज रिमेंबर, स्कॉर्बिटिक रोजरी इज यूजुअली पेनफुल, बट रैकेटिक रोजरी इन रिकेट्स इज पेनलेस. ओके, सो दैट्स इंपॉर्टेंट. दैट इज राउंड, दिस इज शार्प एंड एंगुलेटेड. ओके, सो दैट्स द बेसिक डिफरेंस. Okay, X-ray usually you will discuss in ortho, but I'll just give you a hint. Usually some important features on the X-ray. Okay, so usually X-ray in a case of scurvy, the patient will have some important features. क्या होगा? The patient will have a ring-like epiphysis. Epiphysis is what? End of a long bone. And end of a long bone ring जैसा दिखेगा. That is called as a Wimberger sign. So the patient will have a ring-like epiphysis, बच्चों, known as the Wimberger sign. Apart from that, the patient will have a white line of Frenkel. Okay, that you will study in ortho any which ways. I'm just compiling, trying to compile everything. Every vitamin सब कुछ एक जगह मिलना चाहिए तुम्हें. हर बुक में छानना नहीं पड़े, इसलिए मैं लिखवा रहा हूँ बस. Okay, so white line of Frenkel. There will be a scorbutic zone or a radiolucent zone known as Trummerfeld zone. Usually a Trummerfeld zone, which is a radiolucent zone, जहाँ बोन नहीं बनता है क्योंकि कोलेजन कमी है ना, तो बोन भी नहीं ढंग से बनेगा. सो ट्रमरफेल्ड जोन यूजुअली विल बी सीन. ठीक है, एंड अ पेल्कन स्पर इज यूजुअली सीन. अ पेल्कन स्पर. सो जस्ट इंपॉर्टेंट फीचर्स याद रख लो. इन ऑर्थो यू विल डिस्कस देम इन डिटेल्स एंड जस्ट ट्राइंग टू कंपाइल इट फॉर यू. Wimberger sign, then there is a white line of Frenkel, there is Trummerfeld zone, and finally there is a Pelkan spur, which is usually seen in a case of scurvy on a X-ray or on a radiograph. That has to be remembered. ठीक है, no issues with this, anybody बच्चों? Now talking about infantile scurvy. Infantile scurvy क्या होता है? That means a child who is less than 1 year old will develop manifestations of scurvy. Why? Because please remember, infantile scurvy is definitely scurvy in a child less than 1 year of age. The only reason is the most deficient vitamin. The only reason is the most deficient vitamin in cow milk. Now, the most deficient vitamin in cow milk is definitely, you have to remember, the most deficient vitamin in cow milk is vitamin C. So C for cow milk, C for vitamin C, ऐसे याद रख लो. The most deficient, this was also a previous year question. The most deficient vitamin in cow milk bacho is known as vitamin C. That is the reason when the child is shifted usually, or we add cow's milk to the child's diet after 6 months of age, because till 6 months there is exclusive breastfeeding, बस human milk दिया जाता है. After 6 months, definitely we add cow's milk also to the diet of the child, and now the child will develop definitely vitamin C deficiency. Okay, so that will be called as infantile scurvy usually. No issues with this, anybody? That was all about your scurvy. Now please tell me two important one liners that has come in your examination, so that मुझे इन पे तुम्हारा ज्यादा फोकस चाहिए, इसीलिए I did not given it to you in B9 and B12. I am giving it right now. ठीक है, because both of them are confusing and I wanted to compile it at the same site. So important, if I say, okay, if there is a strict vegetarian person, if there is a strict vegetarian person, or there is a vegan person, okay, which will be the most deficient vitamin in this person? Which will be the most, try to answer it, bacho. Which will be the most deficient vitamin in this person? A strict vegetarian or a vegan diet will lead to which vitamin deficiency? जल्दी से आंसर करो, जो भी लग रहा है जल्दी से आंसर करो, मैंने बोला ये पहले. Very good. Strict vegetarian person or a vegan person, definitely, who is not taking any kind of meat in the diet, who is not taking any kind of meat or egg in the diet, definitely is at a higher risk of developing vitamin B12 deficiency. Okay, is at a higher risk of developing vitamin B12 deficiency because it is only and only present in the animal liver. It is only and only present in the animal liver. That is the reason. Okay? So it has no plant source. And second vitamin which was not having any plant source, bacho. Second vitamin which was not having any plant source, that is vitamin D. Okay, so in a strict vegetarian or a vegan population, there are high chances of vitamin B12 deficiency followed by vitamin D deficiency. Vitamin B12 will be the single best answer. Reason is vitamin B12 has no plant source, whereas it can also not be produced from sunlight. At least vitamin D, patient भले ही vegan है, but at least sunlight की मदद से थोड़ा बहुत तो vitamin D बनेगा, right? That is the reason most deficient vitamin will be vitamin B12 because it cannot be synthesized in our own body also. Vitamin D will be the second most common. Okay, so that's important. No issues with this, anybody? Because why they are why these deficiencies are seen? Because both of these vitamins have no plant source. Both of these vitamins have no plant source. That is the reason deficiency is seen in strict vegetarian or strict vegan. Next is a patient. Usually that was a PYQ. I'll just tell you, a patient who was an IT professional. She was ordering a lot of fast food from she was ordering a lot of fast food from the restaurants, and she was having decreased intake. She was having decreased intake of vegetables, fruits and vegetables in the diet. She is at the risk of developing which vitamin deficiency? Decrease intake of fruits and vegetables in diet, bacho. Decrease intake of fruits and vegetables in the diet. Definitely, she is at a risk of the most deficient vitamin in this patient will be. The most deficient vitamin in this patient will be if she is having decreased fruit and vegetable intake. Anybody try to answer this? What will be your answer? So please remember, this patient will develop deficiency of vitamin B9, that is folic acid. Okay? So a lot of people mark otherwise. क्यों? क्योंकि उन्हें क्या लगा कि they are asking that definitely patient is not having. So please remember, they are saying that patient, they thought that the patient is not having meat. But question उल्टा बनाया था उन लोगों ने. उन्होंने बोला था the patient is not having fruits and vegetables. So if the patient is not having fruits and vegetables, definitely the patient is at a high risk of developing folic acid deficiency or folate deficiency. No issues with this, anybody? That has to be remembered. These are few important questions which have been asked in your examination already. Okay? So with that, definitely I wind up vitamins, and that was everything about vitamins from every subject. I have tried to compile it at one site itself. Okay? That's important. Now, after a break, let's take a break of 15 minutes, and after the break, definitely we'll start with minerals. Minerals is a small topic, very few points and important minerals we'll be discussing only. After that, definitely we'll be talking about basics of biochemistry. ठीक है? चलो. Class will be somewhat long today. ठीक है? Long in the sense, after this break, one session, and after that again one session will be there. 1.5 to 2 hours one session, 1.5 to 2 hours another session. That's it. ठीक है? Chalo, good evening. Again, let's start our session. Now we'll be talking about minerals, बच्चों. ठीक है? We'll be talking about minerals now. Chalo. If I talk about minerals, बच्चों, what did I say? कि vitamins are organic compounds in nature, but on the other hand, minerals are inorganic compounds in nature. ठीक है? So what is the definition of minerals now? So please remember, minerals are nothing but inorganic compounds. Minerals are inorganic compounds. These are inorganic compounds which act as coenzymes. Which acts as coenzymes at various sites or in various reactions, you can say. Okay, so inorganic compounds which acts as coenzymes at various sites or in various reactions of the body. Okay, important is these minerals which are there or these inorganic compounds which are there, okay, they are essential in diet. That means they are not synthesized in your own body, they are not produced in your own body, they have to be taken in the diet. That means they are essential in diet, they have to be taken in your diet, they have to be taken from outside only. Okay, so that's important. Now classification of this mineral, there was a question in the last FMG examination on this. Okay, macro minerals and micro minerals पे question था. The important is what are macro minerals? The minerals which are required in larger quantities. Please remember, minerals in short, minerals and vitamins both are required in minute quantities only. Okay, but if the minerals are required more than 100 mg per day, if the requirement of the mineral is more than 100 mg per day, then they will be called as macro minerals, bachcho. But if the minerals are required less than 100 mg per day, these will be called as micro minerals. More than 100 mg per day, there is a daily requirement, that is what is called as macro minerals. Less than 100 mg is the daily requirement, that is called as micro minerals. What are examples of macro minerals now? The macro minerals which are required in thoda large quantities, these are the remembered by calcium, phosphorus. Okay, so calcium ho gaya, phosphorus ho gaya, sodium, potassium. Okay, so calcium, phosphorus, sodium, potassium, chloride, all of these, okay, all of these are considered as macro minerals. Okay, calcium, phosphorus, sodium, potassium, chloride, all of these are considered as macro minerals. Usually these are considered as macro minerals. On the other hand, if I talk about micro minerals, if I talk about micro minerals, what are micro minerals? Usually micro minerals are required in minute quantities, less than 100 mg. These are usually substances like, so please remember, these are substances like iron, fluorine, selenium, okay, cobalt, copper. So iron, fluorine, selenium, cobalt, copper, usually these will be considered as your micro minerals. These will be considered as your micro minerals. And in the recent last FMG exam, there was a question like this only, that all among the following are micro minerals except, and that exception was calcium. Okay, the others which were given in the option were iron, it was fluorine, and it was selenium, and the fourth one was calcium. So definitely we know that calcium is required in more than 100 mg per day, and therefore it is considered as a macro mineral. Okay, so that is important to remember. Next, if I move further, bacho, let's talk about the next one. First one, that is what is calcium. If I talk about calcium now, so definitely you have to remember that this calcium, what is the major source of this calcium? Calcium is a macro mineral, requirement is more than 100 mg per day. How much it is, I'll talk about that as well, don't worry. The major source of calcium is nothing but your milk itself. The major source of your calcium is nothing else but the milk itself. But it can also be derived from multiple other food substances. And what are those usually? It can be derived from egg, it can be derived from fish, it can be derived from meat, okay, etc. So egg, fish, meat, etc. सबसे derive किया जा सकता है calcium. Otherwise, the richest source is definitely milk itself. The richest source is definitely milk. No issues with this, anybody? Now, important is what are the conditions which will increase the absorption of calcium? What are the conditions when there will be increased absorption of calcium, or what are the substances which are known to increase the absorption of calcium? So please remember, sorry, definitely calcium absorption usually increases. Calcium absorption usually increases when definitely we have increased vitamin D inside the body. Okay, increased vitamin D3 in the body. Increased vitamin D3 in the body is known to increase calcium absorption from the intestine. That we have discussed already, right? So please remember, Vitamin D3, when it increases, definitely that is known to increase calcium as well as phosphate absorption. Okay, and that is also known to increase calcium and phosphate reabsorption from the kidneys as well. Therefore, finally, what will happen? There will be increased levels of serum calcium and increased levels of serum phosphate in the body. Okay, if there is more amount of vitamin D3, definitely. Okay, so vitamin D3 is known to increase the absorption of calcium, whereas definitely, if there is vitamin D deficiency, if there is deficiency of vitamin D, that is known to cause. If there is deficiency of vitamin D3, that is known to cause decreased absorption of decreased absorption of calcium from the body. Sorry, if there is decreased amount of, there is deficiency of vitamin D3, that is known to cause deficiency or decreased absorption of calcium as well. Okay, no issues with this. And if there is decreased amount of calcium in the body, we know the patient will develop hypocalcemia. Okay, the patient will generally develop hypocalcemia, and due to this hypocalcemia, definitely the patient will suffer from which kind of symptoms? The patient will have twitching and all of these features. That is called as tetany. Due to hypocalcemia, the patient will have twitching. Okay, that is spasm of some group of muscle. That will happen. The patient will have tetany, or the patient will also have what? The patient will also have these carpopedal spasm. This carpopedal spasm, bachcho, is known as the Trousseau sign. Okay, the patient will also have this carpopedal spasm known as the Trousseau sign. Or when you tap along the facial nerve, patient will have this kind of twitching, something like this. Okay, that is called as the Chvostek sign. That is known as the Chvostek sign. So please remember, due to hypocalcemia, the patient develops usually tetany. There will be Trousseau sign. There will be Chvostek sign usually. Okay, so that is what is seen in a case of decreased calcium inside the body. The patient will have hypocalcemic features like these. No issues with this, anybody? That has to be remembered. Okay. Now, important is if they ask you about your calcium homeostasis. If they ask you about your calcium homeostasis, definitely. So please remember, there are three important substances which are known to maintain the calcium and phosphate levels in the body. Okay. So one definitely is vitamin D3. Second, you have to remember is parathormone. And the third you have to remember is a hormone known as calcitonin. This calcitonin hormone is secreted by the parafollicular C cells of thyroid gland. These calcitonin hormone is secreted by the parafollicular cells of the thyroid gland. Okay, so that has to be remembered. So this was a previous year question again. Which are the substances responsible to maintain calcium homeostasis? What is homeostasis? Balance. Okay, just remember, homeostasis is nothing but a balance or an equilibrium. Okay, the homeostasis is a balance. Okay, constant environment. So calcium की levels maintain करने का काम तीन चीजों का होता है. First is vitamin D3, second is parathormone, and third is calcitonin. अब इन तीनों का असर अलग अलग होता है on serum calcium and serum phosphate. Okay, these have different effects on serum calcium and serum phosphate, bachcho. Vitamin D3, we know vitamin D3 is known to increase serum calcium as well as it is known to increase serum phosphate levels. Vitamin D3 will increase both serum calcium as well as serum phosphate. But on the other hand, parathormone, हमें पता है parathormone increases the serum calcium levels. How? We know that parathormone activates 1-alpha hydroxylase, which is the rate limiting enzyme of vitamin D synthesis. Therefore, there is more production of vitamin D, and that vitamin D increases calcium absorption and reabsorption, thereby increasing serum calcium levels. Second, parathormone also breaks the bone. That is called as bone resorption. Okay, and therefore all that calcium which was deposited in the bone, after breaking that bone, all that calcium will be released into the blood. ठीक है, so that is called as bone resorption. So जब parathormone ज्यादा होता है body में, please remember there will be bone resorption. That means the bone will be broken down and the serum calcium levels will be increased. Okay, so by that mechanism, the bones will become weak in cases of hyperparathyroidism. That's important. So the patient parathormone is known to increase serum calcium levels, but it is known to decrease serum phosphate levels. Yes, it kicks out phosphate from the body, from the kidney. Okay, therefore it is known to decrease serum phosphate levels. And the third one is your calcitonin. Calcitonin is known to decrease both, बच्चों. ठीक है, so याद रखना, calcitonin is known to decrease both. It will decrease serum calcium as well as it will decrease serum phosphate levels. So these are the three important substances which are known to maintain balance or homeostasis of calcium inside the body, and they have different actions on calcium and phosphate. That has to be remembered for sure. ठीक है, तो याद रखना है बात. Now if I talk about hypercalcemia and hypocalcemia, as I've already told you that hypercalcemia, amia का मतलब होता है blood. That means increased calcium levels inside the blood or in the serum. That is called as hypercalcemia. What are causes of hypercalcemia, बच्चों? One of the cause of hypercalcemia definitely is hyperparathyroidism. One of the cause can be hyperparathyroidism. Why? Because we know that parathyroid hormone is known to increase serum calcium levels. Therefore, if there is increased amount of parath hormone in the body, definitely there will be more amount of serum calcium levels only. But the problem will be the bones will be weak due to excessive bone resorption or excessive bone damage. Okay? Apart from that, definitely the patient like conditions like vitamin D toxicity, that is hypervitaminosis D. I've told you now, when there is more amount of vitamin D inside the body, that is vitamin D toxicity or hypervitaminosis D. Definitely, that is also known to increase serum calcium levels. Okay? And in that condition, I've told you that excess calcium will deposit inside the skin. That is called as metastatic calcification, and there will be chalky plaques inside the skin. That is called as calcinosis cutis. Second feature we discussed, that this extra calcium will deposit in the blood vessel wall, and therefore the blood vessel wall will become harder. The BP of the patient will increase. That is hypertension it will lead to. Okay? So that will be the features. Apart from this, multiple myeloma. Multiple myeloma, bachcho, is a plasma cell cancer. Yes, it is a cancer of plasma cell, but important is it is known to cause bony lytic lesions. That means what? It is known to damage the bone. मल्टीपल माइलोमा में क्या होता है, बोन का डैमेज होता है, एंड दैट इज द रीजन जब बोन का डैमेज होगा तो क्या रिलीज होगा, calcium, and therefore in cases of multiple myeloma the more and more amount of calcium will be released after breaking down the bone, and that calcium will go inside the blood and increase the levels of calcium inside blood. That is, it will also it can also lead to hypercalcemia in the patient. Next is thiazide. Thiazides are from the group of diuretic drugs. Okay? So usually they are diuretics, and we know thiazides and loop diuretics have opposite action on serum calcium levels. Okay? Thiazides are known to retain calcium inside the body. मतलब वो calcium को बचाते हैं. Thiazides retain calcium inside the body. As they retain calcium in the body, that means they keep calcium inside the body. Therefore, they are known to cause hypercalcemia. On the other hand, you will remember loop loses calcium. Okay, loop loses calcium. That means loop diuretics are known to excrete out calcium from the body. Loop diuretics are known to excrete out calcium from the body. Therefore, they will cause hypocalcemia on the other hand. Okay, so that's important. Whereas metastasis agar hota hai, for example, a patient is having some cancer, like for example, a patient is having breast cancer, and from there the cancer has metastasized to bones. What will happen to the bones? Again, there will be damage to the bone. Again, there will be destruction of bone, and when there is destruction of bone, there will be release of calcium in the blood, and that is known to increase the serum calcium level. So these are the usual causes of hypercalcemia in the patient usually. Okay, these are the usual causes of hypercalcemia in the patient. No issues with this, anybody? So as I've told you, in hypercalcemia, the patient will have metastatic calcification. That means deposition of calcium in living tissues of the body at various sites, in various organs. There will be metastatic calcification in the patient. And apart from that, definitely on ECG, if they ask you, there will be QT shortening. Okay, on ECG, definitely there will be a QT shortening. The QT intervals will be shortened out. Okay, so that will be the features of hypercalcemia in the patient. Next is hypocalcemia, bachcho. Hypocalcemia matlab decreased serum calcium levels or decreased levels of calcium inside the blood. Important cause of hypocalcemia definitely will be hypoparathyroidism. जब पैराथ हार्मोन कम होगा बॉडी में, definitely there will be decreased serum calcium levels. So hypoparathyroidism is one cause. Another cause definitely will be deficiency of vitamin D. So deficiency of vitamin D3 is also known to cause decreased serum calcium levels. Why? Because अगर vitamin D नहीं है तो absorption and reabsorption of calcium both will be affected. Therefore, the levels of calcium inside the blood will go down. Apart from that, dietary deficiency of calcium. अगर तुम डाइट में ही कैल्शियम कम खा रहे हो, if somebody is not drinking milk at all in any form, definitely, or not eating meat at any form, not eating egg, definitely that person is liable to develop calcium deficiency, or there will be hypocalcemia in the patient, right? So dietary deficiency of calcium. Malabsorption syndrome, that means a person is not able to absorb calcium from the intestine. Why? Because his intestines maybe are inflamed, or his intestines are, the intestinal cells are damaged. Due to that reason, the patient is not able to absorb calcium. Okay, so therefore, in cases of malabsorption syndrome. Chronic renal failure. In cases of chronic renal failure, what is going to happen? Excess of calcium will be excreted out of the body, right? So in that condition, again, in chronic renal failure, the patient can develop hypocalcemia. Okay, there will be hyperphosphatemia. याद रखना, chronic renal failure में there is more amount of phosphate in the body but less amount of calcium in the body. Hypocalcemia and hyperphosphatemia होता है, ठीक है? Whereas last is acute pancreatitis. In this condition also the patient can develop hypocalcemia. So these are the usual causes बच्चों in which the patient develops hypocalcemia. I've already written about hypocalcemia. The patient develops tetany, the patient develops Trousseau sign, the Chostek sign, or the patient can even develop laryngospasm, which will cause respiratory distress in the patient. ठीक है? And on ECG पूरा उल्टा होगा. Here the patient will have QT prolongation. In hypocalcemia on ECG, definitely the patient will have a QT prolongation. ठीक है? So that is important to be remembered. Next, if I talk about बच्चों iron, if I talk about iron now, ठीक है? So if I talk about iron now, what are the sources of iron usually? So please remember the major source of iron or the richest source of iron. If I talk about the major source or the richest source of iron is actually, this was a previous year question, it is dried pumpkin seeds. Yes, so please remember the richest source of iron is nothing else but the dried pumpkin seeds. We know that iron is very important. Iron is required for hemoglobin synthesis, for heme synthesis, right? So hemoglobin क्या होता है? Heme plus globin. Globin are the protein chains usually, but what is heme? Heme is actually made up of one iron molecule and 4 pyrrole rings usually, right? So as you can see that iron is required for the heme or hemoglobin synthesis that will give color or that will impart color to the RBCs definitely. Okay? So richest source of iron is definitely the dried pumpkin seeds. The other sources of iron, bachcho, the other sources of iron can be green leafy vegetables, something like spinach. Okay? So green leafy vegetables is a rich source of iron again. Okay? Sorry. Apart from that, jaggery, good jo hota hai na, jaggery is also a rich source of iron. So please remember green leafy vegetables and jaggery can be another sources of iron. Okay, so important. No issues with this, anybody? Now if I talk about absorption of iron, bachcho, if I talk about absorption of iron, definitely, so there are few conditions which will cause increased absorption of iron. Which are the conditions which are known to cause increased absorption of iron? First of all, iron absorption requires which kind of a medium? I've already told you, right? Iron absorption requires acidic or alkaline medium. Let me know in the chat box jaldi se. Iron absorption requires acidic or alkaline medium. As I've told you, absorption of iron is mainly from the duodenum. Okay, folic acid ka from the jejunum and vitamin B12 ka from the terminal ileum. So iron from duodenum, folic acid from jejunum and vitamin B12 from terminal ileum. Okay? So please remember, which kind of medium is required? It is the acidic medium. Please remember, acidic medium is required for iron absorption. So iron absorption increases if there is an acidic medium. Apart from that, okay, which vitamin is known to cause? Which vitamin is known to increase iron absorption? So please remember vitamin C. Okay, vitamin C. Why? Because vitamin C is nothing else but ascorbic acid. Vitamin C is nothing but ascorbic acid, right? Acid, na? So as it is acid, definitely it will cause acidic medium and that is known to increase iron absorption again. Okay? So that's important. And amino acid known as cysteine. Okay, amino acid known as cysteine. So this is a PYQ again. Which vitamin is known to increase iron absorption? Answer was vitamin C, because it is ascorbic acid. Okay? So acidic medium, vitamin C, and definitely cysteine are the three conditions where there will be increased absorption of iron. Therefore, if you are giving iron tablets to a person, okay, please ask the person to take that iron tablets. Most of the times we ask the patient to take that iron tablets usually with some nimbu pani. Okay? So with some lemon water, definitely we ask the patient to take that iron tablets. The reason is lemon definitely contains vitamin C or ascorbic acid. Therefore, iron absorption will be much better if it is taken with some lemon water. Okay? Whereas conditions which are known to decrease iron absorption, bachcho, the conditions which are known to decrease iron absorption, please remember these will be your phosphates, okay, phosphates, oxalates, okay, phosphates, oxalates, tannates, okay, phytates. These are the things which are known to decrease iron absorption. Okay, so these oxalates, phytates, or phosphates, these are usually present in green leafy vegetables. Okay, these are usually present in green leafy vegetables, or they can be present in cereals. Okay, so usually grains, cereals, usme present hote hai. So that is the reason they are usually they will affect iron absorption. Apart from that, tannates can be present in grains. Apart from that, tannate is also present in tea or coffee. Tannate is also present in tea or coffee or milk. Important is that is the reason ask the patient to avoid taking milk, tea or coffee, anything with iron tablets. Okay, don't ask the patient to take milk, tea or coffee with iron tablets, otherwise the iron absorption will be decreased. Okay, because tannates are known to decrease iron absorption. That has to be remembered. The phosphate, oxalates, phytates and tannates, these are the conditions or these are the substances which are known to decrease iron absorption. Okay, so that is important. No issues with this, anybody? So please remember. If I talk about ion absorption, guys, from patho you will discuss it in details. I'm just giving you a hint. So for example, this is the lumen of your intestine. Okay, these are your intestinal cells. These are your intestinal cells, bacho. Okay, this is the intestinal cell and this is your blood vessel. Okay, so this is your blood vessel. Important is, please remember, on the intestinal cell we have a transporter for absorption of iron. This transporter, which is located on the intestinal cell on the luminal side, this transporter is what is called as DMT1, that is divalent metal transporter 1. Okay, that is called as DMT1, that is a divalent metal transporter 1. It usually starts absorption of iron. It absorbs the iron in the ferrous form and it stores the iron in the ferric form. Okay, so once it absorbs the iron, then whatever iron is required by the intestinal cells, they will use this iron, and the extra amount of iron which is there, this will be sent to the blood now. Okay, this extra amount of iron will be sent to the blood, and it is sent to the blood via this receptor, via this transporter, which is located on the basolateral side of the intestinal cell, and this is what is called as ferroportin. This is what is known as ferroportin usually. Okay, and this will send this iron into the blood now. Okay, and from here definitely it will go for heme synthesis. From here definitely it will go for your heme synthesis. No issues with this, anybody? That is to be remembered. Important is, there was a question again on this, but important is, please remember, in a case of inflammation, if there is a inflammation in a patient, in a case of inflammation, there is an acute phase reactant, or there is a protein which is released. That protein, bacho, is known as hepcidin. That protein is known as hepcidin, and that hepcidin is known to inhibit this ferroportin. That hepcidin, okay, in cases of inflammation, definitely there is a protein which is released, and that acute phase protein is what is called as hepcidin, and that hepcidin inhibits this transporter known as ferroportin. अगर ferroportin inhibit हो गया तो क्या होगा? Iron absorption तो हो रहा है बच्चों. Okay, iron is getting absorbed in the intestinal cell, but it cannot be sent to the blood now. It cannot be sent to the blood, and that is the reason why heme synthesis cannot occur, hemoglobin synthesis cannot occur, and the patient will develop a microcytic hypochromic anemia. Okay, this type of microcytic hypochromic anemia, bachcho, which is seen, it is known as anemia of chronic disease. Okay, so inflammation kab hota hai? Chronic diseases mein hota hai, right? So this will lead to anemia of chronic disease that we will discuss in pathology as well. I'm just giving you a hint. Okay, this is how it occurs usually. ठीक है? So intestinal cell में तो बहुत iron है, but usually blood में iron कम होता है, and therefore hemoglobin synthesis नहीं हो पाता. ठीक है? So that is important to be remembered. Okay, hopefully you have understood this. Now let's talk about iron overload. Okay, if I talk about iron overload, बच्चों, okay, if there is excess or extra amount of iron inside your own body, okay, if there is an iron overload, this condition, when there is excess amount of iron in your body, there will be excess amount of iron pigment which is formed. And what is that pigment which is formed from iron? That pigment, bachcho, is known as hemosiderin. Okay, that pigment is known as hemosiderin. तो जब ज्यादा आयन है बॉडी में तो ज्यादा हीमोसिडेरिन बनेगा, and this excess amount of hemosiderin will go and deposit in various cells of the body. There is extra amount of iron now, so this extra amount of iron or hemosiderin will go and deposit in various cells of the body, and it will cause damage to those particular cells or to those particular organs. Okay, so please remember, there will be excess amount of hemosiderin, and therefore this condition, iron overload condition, bachcho, is known as hemosiderosis, or it is called as hemochromatosis. This condition is called as hemosiderosis or hemochromatosis. Okay, so that has to be remembered. Now what happens in this hemosiderosis or hemochromatosis? First of all, it is due to which gene mutation? That was your previous year question. So please remember, it is due to HFE gene mutation. This hemosiderosis or hemochromatosis occurs due to a gene mutation that is called as HFE gene mutation. Okay, that commonly occurs due to HFE gene mutation, bachcho. Okay, apart from that, now here there will be a classical feature. Okay, here there will be a classical feature in the patient, and what will be that classical feature? 3 organs will be damaged. This excess of iron, bachcho, or this excess of hemosiderin, bachcho, will go and deposit in various tissues of the body. One of them definitely is the liver. One of them definitely will be your liver. Okay? Most likely there will be some connectivity problem. It will get better, I hope. Okay? So this extra amount of iron will deposit in the liver, bachcho, and that will cause inflammation of the liver. That means the patient will have hepatitis, and finally there will be cirrhosis. Yes, initially there is only inflammation, but finally there is complete destruction or damage of the liver, and that damage of liver is what is called a cirrhosis. So the patient can even develop cirrhosis in the condition. Next, this extra amount of iron which is there, this extra amount of iron is known to activate your melanocytes. It is known to activate your melanocytes. What are melanocytes? Melanocytes are some specialized cells in your skin which are known to produce a pigment known as melanin. And melanin क्या करता है? Melanin gives color to your skin. Melanin gives color to your skin, बच्चों. So if melanocytes are activated, there will be more amount of melanin. There will be more amount of melanin which is produced, and therefore you will see that the skin of this patient will be bronze color. Okay, so there will be bronze pigmentation of skin. Okay, so please remember the patient will have a bronze pigmentation of skin. Usually there will be bronze pigmentation of skin which is seen. And third important side, this extra amount of iron which is there, okay, this extra amount of iron or this extra amount of hemosiderin, it will also deposit inside the pancreas. It will also deposit inside the pancreas. And where exactly in the pancreas? In the beta cells of pancreas, bachcho. And therefore the beta cells of pancreas will be damaged. The beta cells of the pancreas will be damaged due to deposition of this hemosiderin. And the beta cells of pancreas are known to produce a hormone. What is that hormone? Insulin. So as the beta cells are damaged, the patient will develop insulin deficiency. The patient develops insulin deficiency. And जब insulin deficiency होती है, तो what happens to the blood glucose levels? Blood glucose levels will increase. And that is nothing else but diabetes mellitus. That is nothing else but diabetes mellitus. So now, this type of diabetes mellitus has a special name, bachcho. There is bronze pigmentation of skin along with diabetes mellitus. This condition is what is called as bronze diabetes. Okay, so this is what is called as bronze diabetes. So bronze diabetes occurs in which condition? It occurs in hemochromatosis or hemosiderosis, which is nothing but iron toxicity or an iron overload condition. Iron toxicity or iron overload condition. Okay, so that's important to be remembered. No issues with this, anybody? So these are the usual features which can be seen in a case of iron overload or hemochromatosis in the patient. Treatment क्या करोगे बच्चों? So please remember, for treatment definitely in this condition we have to give a chelating agent. जब भी कोई metal बढ़ता है ना body में, we have to give a chelating agent. What is a chelating agent? Chelating agent is the one which will go, it will bind with this metal and it will take the metal out of the body. It will go, it will bind with this substance and it will excrete out this substance from the urine out of the body. Okay, that is usually an injectable drug which is given in this patient. And classical history आता है, classical case आता है, a child has ingested 10 or 20 iron tablets and now comes to the emergency. Okay, that is a case of acute iron poisoning. That is not a case of hemochromatosis, that is a case of acute iron poisoning. But there also we use this drug. Okay, it is an injectable chelating agent known as desferoxamine. Okay, that is what is called as desferoxamine. Whereas if there is a chronic iron overload condition, if there is a chronic iron overload, we use an oral drug. Oral tablet is given and that is called as oral deferiprone. Okay, that is known as oral deferiprone. Okay, so that was about your excess of iron or iron overload inside the body. Okay, no issues with this, anybody? So please remember this. Okay, you will discuss it much better and depth in pathology. Usually I'm talking about iron, I'm giving you hints. That is the basics. Then you will dive deeper into these topics when you are studying pathology. Important is, that was about iron excess. Now if I talk about iron deficiency, we know classically iron deficiency leads to anemia. That is your iron deficiency anemia. Rather, iron deficiency anemia is the most common type of anemia. Okay, we know that the most common type of anemia definitely, okay, the most common type of anemia is nothing else but your iron deficiency anemia itself. Iron deficiency anemia. Okay, no issues with this. And if I talk about iron deficiency anemia, क्या होता है iron deficiency anemia में? Definitely the patient will have features of classical features of anemia, that is your pallor and fatigue. वो तो होगा ही होगा. Apart from that is the peripheral blood smear which is there. The peripheral blood smear classically shows microcytic hypochromic RBC. What do I mean by microcytic? The size is smaller. Hypochromic, as hemoglobin is not formed, the RBCs will not be red in color completely. Okay, they will appear pale or white in color. Okay, so microcytic hypochromic RBCs will be seen. Microcytic hypochromic RBCs. Apart from that, bacho, the patient will also have these pencil cells on the peripheral blood smear. Pencil cells, elongated RBC. Normally RBCs appear circular on peripheral blood smear, but ऐसे कुछ cells दिखेंगे. ठीक है? Apart from that, clinical features में pallor और fatigue के अलावा, the patient has a classical feature known as koilonychia. What is koilonychia? Spoon-shaped nails or spooning of nails. Okay, spoon-shaped nails are seen. That is called as koilonychia. The patient can also have, if iron deficiency anemia is seen in a child, then the child will have Pica. What is pica? Usually the child eats non-nutritive food substances. What do I mean by non-nutritive food substances? That means the child can eat mitti khayega bachcha ya chalk khayega bachcha. Okay, so that is what is called as pica. So these are the usual features which can be seen in the cases of iron deficiency anemia. And we know if there is iron deficiency, we can give iron tablets. That is, iron supplementation should be given. Either it can be oral iron tablets which we can give, or it can be injectable iron which can be given. Please remember, bioavailability of both iron is same. So that is not the case that IV will be preferred over oral. No, it depends on the condition of patient. If patient is able to take it orally, better to give it orally only. Okay, that's the important thing. If patient is unable to take it orally, or the patient is having some intestinal disease due to which iron absorption is not possible, in that condition definitely you can give it IV. Otherwise ऐसा कुछ नहीं है कि definitely the patient shall be given IV क्योंकि better absorption होगा. No, absorption is same, bioavailability is same as both. Definitely if the patient is having severe anemia तो IV देंगे, अगर mild to moderate anemia होगा तो oral देंगे tablets. ठीक है? So that's the important thing. No issues with this anybody? Hopefully that's clear to all of you. चलो. Now if I talk about copper, guys, अगला जो है that is what is copper. So if I talk about copper, what are the sources of copper? So usually copper is derived from the nuts, the grains, or the vegetables. Okay, copper is generally derived from nuts, grains, or vegetables itself. Okay, importance is what are the functions of copper? So please remember, copper is actually a metal, right? And this copper is it acts as a cofactor. Vitamins will act as coenzymes. The water-soluble vitamins will act as coenzymes, but metals will usually act as cofactors. What is the basic difference? We'll discuss it later in enzymes. But just remember, अगर metals की बात हो रही है तो उनको cofactors बोला जाएगा. But अगर vitamins की बात हो रही है तो उनको coenzymes बोला जाएगा. Cofactors का काम coenzymes की तरह ही होता है. That means they are the supporting structures to the enzymes. They will support the enzymes or they will increase the activity of the enzyme. इतना याद रखना है. So please remember, copper is a cofactor. Okay, copper is actually a cofactor for most oxidases in the body. Yes, कौन से enzymes के लिए? Oxidases के लिए. So most of the oxidases which are there now in the body, okay, most of the oxidases in the body definitely they require copper as their cofactor. Okay, so it is a cofactor for most of the oxidases in the body. Okay, lysyl oxidase, E oxidase, O oxidase. So there are multiple oxidases in the body. All those oxidases will require copper itself. Except few of them definitely that we'll discuss. Xanthine oxidase does not require it. Sulfide oxidase does not require it. Okay, no issues to anybody. Important is this copper is also responsible for iron metabolism. Okay, if you need to have iron absorption or if you need to degrade iron, for both of the conditions definitely copper is required. Okay, because for iron metabolism we require oxidases enzymes, and we know that copper acts as a cofactor for them. Okay, so that's the reason. Important is we have a copper transport protein. Okay, that is called as ceruloplasmin. So what is ceruloplasmin? Please remember, ceruloplasmin is nothing but a transport protein for copper. Okay, so copper will bind with ceruloplasmin and then definitely it will be transported via blood to the various tissues or various cells of your body. Okay, so ceruloplasmin bacho is nothing but a transport protein of copper. It belongs to which family? It belongs to the alpha-2 globulin protein family. It belongs to the, we have alpha globulins, beta globulins, gamma globulins. No, these are nothing but families of proteins inside your body. So ceruloplasmin belongs to the alpha-2 globulin family and it has a peroxidase activity. What do I mean by peroxidase activity? That means the ferrous form of iron will be converted to the ferric form. Okay, and this ferric form is usually stored in the body. This ferric form is actually stored in the body, right? In the intestinal cell. Transport के लिए ferrous form is required, but storage के लिए ferric form is required. याद रखना. Okay, so that's important. So this ceruloplasmin has a peroxidase activity. That means it converts the ferrous form into the ferric form usually. Okay, so that is what is the action of ceruloplasmin. No issues with this anybody? Okay, hopefully you have. Okay. Next is copper excretion. Please remember guys, this copper excretion, this copper is not excreted via kidneys बच्चों. This copper is not excreted via kidneys. तो कैसे excrete होता है copper? तो copper is excreted via the biliary route. तो please remember, excreted via bile. Yes, copper kidneys से excrete out नहीं होता है. That is important to be remembered. ठीक है? So copper is excreted. It is excreted via the biliary route. It is excreted via the biliary route, not via the kidneys. ठीक है? It is excreted via the biliary route. So please remember, अगर biliary route से वो excrete out होता है, okay, उसका reabsorption भी हो सकता है. नहीं होता पर. Okay, so that's important. Definitely there is no reabsorption of copper which takes place. Once it is excreted out via bile, it will be excreted out from the stools itself. ठीक है, तो please remember it is excreted via the biliary route and there will be no reabsorption. There will be no reabsorption. Okay, that is how it can be excreted out from the body. Okay, so that is important to be remembered. So if there is a condition where there is blockage or when there is obstruction in the bile duct, okay, so in that condition what will happen? Will the bile be able to go to the intestine? No. Will the bile be able to excrete out? No. So if bile is not going out, will the copper go out? No. So please remember, if there is impaired drainage of bile or if the bile is not able to go into the intestine, that means the patient will also develop copper toxicity in that condition. Why? Because the copper is not able to excrete out. What are those conditions usually? So those conditions which will cause impaired excretion of copper, those conditions which will lead to impaired excretion of copper, bachcho, where there will be impaired excretion of copper, definitely it will be whenever there is obstruction in the bile ducts. These are conditions like primary biliary cirrhosis. Okay, that means your bile ducts which are there, they are damaged completely. Due to that, bile is not able to flow out. Okay, so primary biliary cirrhosis. Next condition is primary sclerosing cholangitis. Okay, so second condition is primary sclerosing cholangitis. There is fibrosis or there is sclerosis of the bile ducts. So bile ducts are closed. Again, due to that reason, the bile are not able to flow out. So usually in these conditions like primary sclerosing cholangitis or primary biliary cirrhosis, in these conditions, the bile drainage is affected, due to which definitely the copper excretion is also affected. The copper excretion is also affected. No issues with this, anybody? That has to be remembered. Okay? Okay, have you understood this? प्लाज्मा कॉपर ट्रांसपोर्ट मतलब ब्लड में बच्चों या प्लाज्मा में कॉपर ट्रांसपोर्ट कौन करवाएगा? तो प्लीज रिमेंबर, आउट ऑफ द टोटल कॉपर व्हिच इज प्रेजेंट इन द ब्लड, 80% of copper बच्चों, 80% of copper is bound to ceruloplasmin. 80% of copper it is bind to ceruloplasmin usually, and it is transported in the blood in the with the help of ceruloplasmin itself. So please remember. Okay, so please remember, गॉल ब्लैडर सर्जरी में बाइल तो बनती है ना यार, गॉल ब्लैडर सर्जरी में बाइल बनती है ना, बाइल बनाने का काम गॉल ब्लैडर का नहीं होता, बाइल बनाने का काम लिवर का होता है, बाइल कॉन्सेंट्रेट करने का काम गॉल ब्लैडर का होता है बस. ठीक है, एंड देयर इज नो ऑब्स्ट्रक्शन. हम बाइल डक्ट थोड़ी बंद करते हैं, हम बस गॉल ब्लैडर निकालते हैं एंड वी फॉर्म अ सिस्टिक डक्ट स्टंप यूजुअली. ठीक है, so that's the reason. Excretion तो होता रहता है. So no issues with this. 80% of the plasma copper is transported by binding with ceruloplasmin. Now let's talk about some disorders of copper metabolism बच्चों. कॉपर अगर मेटाबोलाइज नहीं होता है, उसका अब्जॉर्प्शन ज्यादा होता है या अब्जॉर्प्शन कम होता है या फिर एक्सक्रीट आउट नहीं होता है, तो क्या होगा? सो प्लीज रिमेंबर, the first disorder of copper metabolism you have to remember, the first disorder of copper metabolism you have to remember is known as Mednick. The first disorder of copper metabolism is known as Mednick बच्चों. This Mednick is actually inherited मतलब which runs in the families. Okay, it is an inherited autosomal recessive disorder. So the pattern of inheritance which is there, it is autosomal recessive. It is an inherited autosomal recessive disorder बच्चों. It is an inherited autosomal recessive disorder. Now, Mednick is actually an abbreviation of all the features or all the symptoms which are going to occur in the patient. As there is copper deficiency in the patient, please remember the patient will have M for mental retardation, or new name is intellectual disability. So the patient will have mental retardation, M for mental retardation, E for enteropathy. So what happens in this patient is definitely there is enteropathy or there is damage to the intestinal cells, due to which there is decreased absorption of copper, due to which there is decreased copper absorption. Okay, so that is the problem. Enteropathy is there in the patient, due to which there is decreased copper absorption from the intestine. Okay, next D stands for deafness usually. Okay, D stands for deafness. Next, N stands for neuropathy. The patient will have multiple neurological manifestations, or the patient will have this peripheral neuropathy like features as well. So the N stands for neuropathy. I stands for ichthyosis. What is ichthyosis? Dry scaly fish like skin. ठीक है, अगर स्किन पे क्रैक्स पड़ जाते हैं ना, देखते हो तुम, तो फिश जैसे फिश के स्केल्स जैसी स्किन दिखाई देती है. दैट कंडीशन इज व्हाट इज कॉल्ड एज ichthyosis. You will study that in derma in depth. Okay, so ichthyosis is nothing but dry scaly fish like skin. It is nothing but dry scaly fish like skin. Okay, that is what is called as ichthyosis बच्चों. ठीक है, so that is important. And last is keratoderma usually. Okay, there is excess keratin production in the skin, that is keratoderma usually. No issues with this, anybody? So these are the features which are seen in Mednick, which is a rare disorder though, so therefore it is not very commonly asked, but you have to remember it, okay, if they ask you at any point of time. Okay, because as I've told you, in exams they ask two types of question, one which is very common and second which is fancy. So this one is a fancier one. Okay, so that's important. Next, if I talk about copper toxicity, bacho, if I talk about copper toxicity, it is due to excess use. Okay, it is due to excess use or more use of brass utensils. If some family or some people are using brass utensils on a regular basis, okay, if there is more use of brass utensils in a family, definitely those patients or those people are at a risk of developing copper toxicity. Okay, when there is copper toxicity, what is going to happen? There will be RBC destruction. Okay, no, Dharma, somebody else will teach. I don't. Okay, so please remember, hemolysis will be there. That is RBC destruction is going to happen in the patient. Okay, next is definitely renal damage. Okay, there will be excess damage to this. Excess of copper will deposit in the kidneys and that will cause renal damage as well in the patient. Okay, apart from that, bacho, there will be bluish green colored. There will be bluish green stools as well as urine. There will be bluish green stool as well as urine. I hope all of you are quite aware that copper sulfate which is there na, that copper sulfate is usually bluish green in color. Lab में देखा होगा ना, blue green color का होता है copper sulfate. तो इसीलिए bluish green stools and urine are seen in a patient who has developed copper toxicity usually due to formation of that copper sulfate. ठीक है? So that is what is seen in a case of copper sulfate copper toxicity. ठीक है? Next important, bacho, is known as Menkes disease. These two are important now. The first two, as I've told you, they are rare and they are fancier ones only. But now the two conditions that I'm going to talk about, one is Menkes, second is Wilson's. These are important. Okay. If I talk about Menkes disease, guys, what is Menkes disease? Bacho, Menkes disease is nothing but copper deficiency. Menkes disease is nothing but copper deficiency. Kam ho jata hai copper body mein. Okay. Important is it is a X-linked recessive disorder. It is a X-linked recessive disorder. What do I mean by X-linked recessive disorder? That means only males will be having the disease. Only males will be having the disease, whereas females will just be carriers of the disease. Females will not have any kind of symptoms. Only males will have the symptoms. That is the X-linked recessive disorder. Okay? Important is, as there is copper deficiency, so copper is required as a cofactor by which enzymes in the body? By oxidases of the body. And one important oxidase, bacho, is known as lysyl oxidase. Okay, one important oxidase is known as lysyl oxidase. And where is this lysyl oxidase required? So please remember this lysyl oxidase which is there. Okay, this lysyl oxidase, it is the final enzyme. It is the final enzyme of collagen synthesis, where a pro-collagen is converted to the mature collagen, where a pro-collagen is converted to a mature collagen. Okay, so please remember, it makes the collagen stronger. इस step से वजह से क्या होता है? Pro-collagen is converted to mature collagen, that makes the collagen more strong definitely. ठीक है? And for that, the enzyme which is required, बच्चों, is known as lysyl oxidase definitely. Okay, and for that the lysyl oxidase requires copper as its cofactor. Okay, copper as its cofactor. So lysyl oxidase is definitely required for collagen synthesis. Okay, it is required for collagen synthesis definitely. Okay, so please remember, if lysyl oxidase is there, definitely it requires copper as the cofactor. Okay, copper is cofactor for this lysyl oxidase. So if there is deficiency of copper in a patient, if there is deficiency of copper in the patient, will this lysyl oxidase work? No, this lysyl oxidase is not going to work. And if this lysyl oxidase is not going to work, the collagen synthesis, will it be effective? No. The collagen synthesis will occur, but जो collagen बनेगा finally, वो कैसा होगा बच्चों? बहुत ज़्यादा weak होगा. Okay, वो strong collagen नहीं बन पाएगा, क्योंकि जो final step थी, जो collagen को strong बना रही थी, by cross bond formation, that has not occurred. That is the reason why definitely the collagen which will be formed in this patient will be very, very weak. And we know collagen is present at every site in our body, right? Collagen is present at every site in our body definitely. Okay, so that is the reason why here, as the collagen will be defective, the patient will have multiple manifestations. What will be the clinical picture of the patient? The child will have a premature birth. Okay, the child will have a premature birth usually. Apart from that, the child will have hypotonia. What is hypotonia? Decreased tone inside the muscles. Okay, the child will have hypotonia, that is nothing else but decreased tone of the muscles. The child will have growth retardation as well. Okay, the child will also have growth retardation. And finally, the child is going to have mental retardation as well. intellectual disability. The child is going to have mental retardation or intellectual disability. More important feature which is very specific and characteristic. The child will have, as collagen is also present in hair, right? And यहाँ पे जो collagen बना है वो बहुत ज़्यादा weak बन गया है. Therefore, definitely the hairs will be weak of this child, and the child will have sparse मतलब कम hair होंगे बच्चों. Okay, the child will have sparse, kinky. What are kinky? Curled hairs होंगे, ठीक है, and easily breakable होंगे. So the child will have sparse, kinky, brittle hair. The child will have sparse, kinky, brittle hair. This is a very characteristic feature they mention in Menkes disease. Okay, the child will have sparse, kinky, brittle hair. The child will have sparse, kinky, brittle hair usually. Okay, so that is what is seen. So along with hypotonia, growth retardation, mental retardation, sparse, kinky, brittle hair usually is a classical feature in a case of copper deficiency, also known as Menkes disease. Definitely important is previous year. This will be discussed in patho anyhow, but I'll talk about the gene mutation. The gene mutation which is seen over here is known as ATP7A gene mutation. Here the gene mutation which is seen in this condition is known as the ATP7A gene mutation. So ATP7A gene mutation is seen, or it is a cause of Menkes disease, that is a copper deficiency. No issues with this, anybody? That has to be remembered. Okay, so that was all about your Menkes disease. If I talk about Wilson's disease on the other hand, what will be seen in a case of Wilson's disease now? So please remember, Wilson's disease is completely opposite to that of Menkes. Matlab, Menkes was copper deficiency. On the other hand, Wilson's बच्चों is nothing but copper excess. या ज़्यादा copper होता है body में. Okay, so Wilson's is nothing but a copper excess वाला condition. Pattern of inheritance of Menkes disease was X-linked recessive. It was an X-linked recessive disorder. But the pattern of inheritance of Wilson's disease बच्चों is autosomal recessive. Okay, so please remember, Wilson's disease is actually autosomal recessive disorder, AR. Okay, autosomal recessive disorder it is. Important is the gene mutation in Menkes disease was ATP7A gene mutation, but the gene mutation in Wilson's disease is ATP7B gene mutation. Okay, the gene mutation which is seen in Wilson's is known as ATP7B gene mutation. कैसे याद रखना है? A lot of times we tend to get confused. M पहले आता है बच्चों, M पहले आता है, A पहले आता है, ठीक है? So that is ATP7A gene mutation is seen in Menkes disease. W बाद में आता है, B बाद में आता है. Therefore, Wilson's disease में it is ATP7B gene mutation. That's how simple it is. No mnemonic, nothing is required. ठीक है? So just remember that ATP7B gene mutation. Important is this Wilson's disease. There is copper excess inside it. Okay, and therefore this excess of copper will be going to multiple sites into multiple organs, and it will be deposited in multiple organs of your body, and that is going to cause damage to those particular organs, right? So that is going to happen over here. क्योंकि आयन भी हमने देखा, जब आयन ज्यादा था वो अलग अलग टिश्यूज में डिपॉजिट हो रहा था और उनको डैमेज कर रहा था. वैसे ही excess of copper is going to deposit into various tissues or organs of your body, and it is going to damage them. Okay, Wilson's disease is what is called as hepatolenticular degeneration. Why? Let's understand that now. Okay, Wilson's disease is known as hepatolenticular degeneration. Okay, it is known as hepatolenticular degeneration. Why? Because this excess of copper which is there, bacho, this excess of copper which is there, first of all, it will deposit inside the liver. It will deposit inside the liver, and what will happen? It will cause inflammation of the liver initially. Initially, in the early stages, it will only cause inflammation of the liver, that is hepatitis will occur. But in final stages, what will happen? It will cause complete damage to the liver, that is cirrhosis is going to occur. Okay, in final stages, it will cause complete damage of the liver, that is what is cirrhosis will occur. Apart from this, bacho, definitely this excess of copper which is there, this excess of copper will deposit inside the brain as well. In which part of the brain, bacho? Mainly in the basal ganglia. This excess amount of copper will deposit inside the basal ganglia, and this basal ganglia is also known as lenticle. This basal ganglia is also known as lenticle, and as this excess of copper deposits in the basal ganglia or lenticle, there will be damage of that basal ganglia or lenticle also, right? That is the reason why Wilson's disease can also be referred to as hepatolenticular degeneration. Got it? So that's the reason. And when it deposits in the basal ganglia, mainly in which part of basal ganglia, bacho? Mainly in substantia nigra. Mainly in the substantia nigra. Okay, and ये substantia nigra का क्या काम होता है? It is known to produce a neurotransmitter known as dopamine. This substantia nigra is known to produce a neurotransmitter known as dopamine. But as this excess of copper is depositing inside the substantia nigra, there will be damage to the substantia nigra, and therefore the patient will develop dopamine deficiency. the patient will develop deficiency of dopamine, due to which the patient will develop features like which condition, which neurological condition has sorry, which neurological condition has dopamine deficiency, or which neurological condition develops due to dopamine deficiency? Jaldi se batao. Comment in the chat box. The patient is going to have tremors. The patient is going to have pin rolling tremors, resting pin rolling tremors. The patient is going to have rigidity or stiffness of the muscle. And third, the patient will have slowness of movement. Slowness of movement is called as bradykinesia. Bradykinesia. Okay? So rigidity, slowness of movement, spin rolling tremors. Classical features of which neurological disease? Parkinsonism. Very good. So therefore, in cases of Wilson's disease, the patient is going to develop Parkinsonism-like features. The patient is going to develop Parkinsonism-like features. Okay? The patient is going to develop Parkinsonism-like features. ये 3-4 features ऐसे mentioned होंगे ना, along with liver damage, along with jaundice बोलेंगे वो तुम्हें, ठीक है? Liver damage जैसे jaundice या right hypochondrium pain, hepatomegaly, ऐसा कुछ भी बोलेंगे. Think in terms of Wilson's disease, liver plus basal ganglia, दोनों के अगर features दिए होंगे तो, ठीक है? Apart from that, the third site where it is going to deposit, okay, it will be your eyes. And in eyes, usually it can deposit at 2 sites again. Okay, in eyes it can deposit in the Descemet's membrane of cornea. Okay, it can deposit in the Descemet's membrane of cornea, and it will lead to formation of a ring, bachcho. It can deposit in the Descemet's membrane of cornea, and it will lead to formation of a ring, and that ring, bachcho, is known as the Kayser-Fleischer ring. That ring is what is called as the Kayser-Fleischer ring. Okay, that ring is what is called as the Kayser-Fleischer ring, or the KF ring, which is seen in the eyes. Okay, that we will discuss in ophtha as well. So Kayser-Fleischer ring is due to excess deposition of copper in the Descemet's membrane of cornea. Whereas second, it will also deposit inside the lens of the eye. It will also deposit in the lens of the eye. Lens normally transparent hoti hai, but when copper will deposit inside the lens of the eye, okay, what will happen? The transparency of the lens will be decreased, or there will be opacity inside the lens. Opacity inside the lens is called as cataract. And this special type of cataract, which is due to deposition of copper inside the lens, bachcho, is what is called as the sunflower cataract. Okay, so the patient will have a classical sunflower cataract as well. Okay, the patient will have a classical sunflower cataract. No issues with this, anybody? So these are the important things. Renal damage bhi hoga patient mein, hemolysis bhi hoga. But at least these are the 3 most important organs which you have to remember. Liver mein there will be hepatitis and then cirrhosis. In basal ganglia there will be Parkinsonism-like features. And when it deposits the eyes, 2 features. One is the Kayser-Fleischer ring. Second is the sunflower cataract usually. Okay, so that has to be remembered. Okay, and if they ask you what is the treatment of choice or what is the drug which is given, usually the drug of choice which we give in cases of Wilson's disease is known as zinc acetate, and the chelating agent that we can give is known as D-penicillamine. Okay, the drug of choice which we give is known as zinc acetate, and the chelating agent that we give is known as D-penicillamine. Okay, so these are the ones definitely you have to remember. Okay, these are the ones that you have to remember in cases of Wilson's disease. Okay, so that was all about your copper. Okay, copper deficiency discuss ki, that is Menkes disease. Copper excess discuss kiya, that was what is your Wilson's disease. No issues till anybody? Okay, so now moving forward to the next one, that is called as selenium. Okay, so selenium, we know it is a micro mineral which is required in very minute quantities, less than 100 mg per day. Okay, so that is what is your selenium. Important is, please remember bacho, selenium, it is a part of your 21st amino acid. Yes, initially we only had 20 amino acids, but now we have 22 amino acid, and the 21st amino acid bacho is known as selenocysteine. The 21st amino acid is known as selenocysteine usually. Okay? And in that selenocysteine, can you see selenium is combining with cysteine, and that is forming selenocysteine. That is what is your 21st amino acid. So selenium is a part of 21st amino acid. For 21st amino acid synthesis, we require selenium in the body. Second is, it is also a part of the glutathione peroxidase enzyme. This glutathione peroxidase enzyme also requires selenium in its structure. So glutathione peroxidase एक enzyme होती है, it also requires selenium in its structure. And ये glutathione peroxidase जो होती है बच्चों, this glutathione peroxidase enzyme जो होती है, that is important. It is also required for neutralization of your free radicals. That means you can just remember it is an antioxidant enzyme. It is an antioxidant enzyme usually. Okay, so can you see that selenium is required by enzyme which is responsible for yeah, it is a post-translational or a derived amino acid. Okay, so antioxidant enzyme which is there, definitely this antioxidant enzyme known as glutathione peroxidase, which is responsible for scavenging or neutralization of the free radicals. This requires selenium as the cofactor. Therefore, selenium can also be referred to as an antioxidant. Yes. Okay. So please remember, selenium also acts as an antioxidant, we can see. Okay. Next important, selenium also has a role in spermatogenesis as well. Okay. Selenium also has a role in spermatogenesis or sperm production as well. Next is what is Keshan's disease. What is Keshan's disease, बच्चों? Keshan's disease is nothing else but deficiency of selenium. अगर बॉडी में सेलेनियम की कमी हो जाती है, that is what is called as Keshan's disease. ठीक है? So please remember, Keshan's disease is nothing but deficiency of selenium. Okay, it is nothing but deficiency of selenium. Now that deficiency can either occur when there was decreased amount of selenium which was taken in the diet. That is, dietary deficiency of selenium is the most common cause of Keshan's disease. Or another can be if the patient was having some malabsorption syndrome, due to which the selenium which was taken, it was not absorbed properly by your intestine. So either dietary deficiency or some malabsorption definitely can lead to deficiency of selenium in the body, and that is what is known as Keshan's disease. बस इतना ही पूछा था, deficiency of selenium causes. Answer was Keshan's disease. But now we know, as they are asking clinical questions, it is important to know the features as well. So now please remember, Keshan's disease, bachcho, is nothing else but a type of cardiomyopathy itself. Okay, so the patient develops a cardiomyopathy. It is a type of cardiomyopathy. There are three types of cardiomyopathy: hypertrophic obstructive, next is restrictive, and third is dilated. So please remember, this one is a dilated cardiomyopathy. Okay, Keshan's disease is nothing but an example of dilated cardiomyopathy. Okay, there is damage to the heart. There is a dilatation of all the chambers of the heart. Okay, and therefore the heart is not able to pump effectively. That is what is called as a dilated cardiomyopathy usually. It is also seen in alcoholic patients. Rather, the most common cause of dilated cardiomyopathy is alcohol itself. But it can also be seen due to selenium deficiency in a case of Keshan's disease. Okay? Apart from that, the patient will also have muscle weakness and there will be muscle dystrophy as well. Dystrophy is nothing but damage to the muscle. So the patient can have muscle weakness as well as muscle dystrophy. The patient will have, or the child will have, inability to gain weight. याद रखना, यहीं पे समझ लो तो पीडिया में इजी जाएगा. Inability to gain weight बच्चों is known as failure to thrive. तो जब वो failure to thrive बोलते हैं, उनका मतलब होता है बच्चे का वजन बढ़ नहीं पा रहा है. Inability to gain weight is what is called as failure to thrive. That is also seen in a case of Keshan's disease. Failure to thrive can be seen in multiple conditions. Multiple. Okay? So apart from that, the patient will have hypothyroidism. The patient will also have hypothyroidism, that is decreased T3 and T4 levels in the body. And lastly, the patient can also develop hypertension. Okay, lastly, the patient can even develop hypertension usually. So these are the features, please remember, in a case of Keshan's disease or in cases of selenium deficiency. Treatment is nothing but selenium supplementation has to be given to the patient. Okay? If there is a selenium toxicity in the patient, so please remember, selenium toxicity क्यों होती है patient में? Selenium toxicity is due to accidental ingestion of anti-rust chemicals. Okay? Rust prevent करने के लिए अपने पास जो chemicals होते हैं ना, to prevent rust, okay, जंग लगने से बचाने के लिए जो chemicals use करते हैं हम. So in that anti-rust chemicals, you have a lot of selenium. Or this extra amount of selenium, excess amount of selenium is also present in metal polishings. जो polish आती है ना metal को चमकाने के लिए, in that metal polishings also we have a lot of selenium. So definitely, if the patient takes anti-rust chemicals or metal polishings, क्यों पिएगा वो? Suicide के लिए, obviously, right? So in that conditions, when he drinks a lot of anti-rust chemicals or metal polishings, in that patient definitely there's a high risk of selenium toxicity. Selenium toxicity is rare though. Selenium deficiency is much more common. Selenium toxicity में the patient will have diarrhea, the patient can have weight loss, and the patient will have a garlicky breath odor. In forensic medicine, you will study a lot of garlicky odor from garlicky breath odor. It is also seen in OPC poisoning. It is also seen in arsenic poisoning. Also seen in thallium poisoning, and also seen in selenium toxicity as well. ठीक है? Garlicky breath odor. Breath का जो odor होता है वो लहसुन जैसा आता है, garlic जैसा आता है. ठीक है? So that is what is seen. No issues with this, anybody? So that is important. Next, if I talk about, shall we move further? Please tell me. So I'm going faster because these are the ones which are not so commonly asked in your examination. Yeah, wherever it is asked, I'm marking it. Keshan's is commonly asked in your exam, so I've marked it. Copper was important, iron was important. Those two were definitely important. Calcium was important. Now, as these are the minor ones, therefore I'm speeding it up. Okay? Next is what is fluorine, bacho. Next is what is fluorine now. So please remember, fluorine is a micro mineral as well. It is required in minute quantities, less than 100 mg per day again, and it is a double S word. Please remember, it is a double S word. What do I mean by double S word? Matlab, फ्लोरीन कम भी हो जाएगा तो भी दिक्कत है, फ्लोरीन बढ़ भी जाएगा तो भी दिक्कत है. Okay, फ्लोरीन deficiency is also a problem, फ्लोरीन excess is also a problem. That is the reason it has to be maintained in a very specific level inside the body. Okay, if I talk about fluorine, if they ask you what is the most common source of fluorine, तुम्हारे बॉडी में आता कहां से fluorine? The most common source of fluorine बच्चों is drinking water. Yes, the most common source of fluorine is what is your drinking water itself. And how much should be the level of fluorine inside drinking water? So the level of fluorine inside drinking water, this is a PSM question, it is 0.5 to 0.8 ppm or parts per mole. Okay, the level of fluorine inside drinking water bachcho, it should be between 0.5 to 0.8 parts per mole or 0.5 to 0.8 milligram per liter. Okay, that is one and the same unit. Okay, if definitely fluorine is more than this, definitely if the fluorine is more than 1.5, it is going to cause, it is definitely going to cause fluorosis, that is fluorine excess condition. Okay, whereas if the level of fluorine is less than this, that is less than 0.5 usually, it is known to cause fluorine deficiency. Okay, so if level of fluorine is less than 0.5 ppm in the water, if the level of fluorine is less than 0.5 ppm, definitely the patient is known to develop fluorine deficiency, and due to fluorine deficiency the patient will develop dental caries. Due to fluorine deficiency the patient will develop dental infection or dental caries usually. Okay, so that is important. Whereas if I talk about fluorine excess bachcho, fluorine excess, what did I tell you? It usually develops when there is more amount of fluorine in the body, mainly more than 1.5 ppm. So usually fluorine excess, this condition is known as fluorosis. Osis का मतलब होता है excess, ठीक है? तो fluorosis, fluorine excess usually develops a condition and that is called as fluorosis. And this fluorosis is usually seen when the amount is more than 1.5 ppm. Okay, if the amount of fluorine in drinking water is more than 1.5 ppm, definitely the patient is going to develop dental fluorosis. Yes, the first site which is affected in fluorosis, bachcho, the first site which is affected in fluorosis are the teeth itself. Okay, and this was a previous year question, which teeth? So please remember the first change which is seen in cases of dental fluorosis is seen in which teeth. So you have to answer the first change is noticed in, there will be brownish discoloration, brown color discoloration दिखेगा कौन सा teeth में? Upper central incisors, that has been asked. Okay, so the first change will be observed in the first upper central incisors. First change of dental fluorosis is observed in the upper central incisors. This was a previous year question. Okay, so that has to be remembered. Then if the level of fluorine is between 3 to 6 parts per mole, if the level of fluorine is between 3 to 6 parts per mole, it is going to cause skeletal fluorosis. Okay, it will deposit inside the bone and it will damage the bone. That is going to cause skeletal fluorosis. In a patient of skeletal fluorosis, definitely the patient is going to have brittle bones. Why? Because the fluorine deposition inside the bones will make the bones weaker and the bones can fracture easily. That is what is called as brittle bones, easily breakable, right? So the bones will be brittle bones which are easily breakable. Apart from that, this excess amount of fluorine will deposit inside the tendons and ligament, and there will be calcification of the tendons and ligaments. Okay, the ligaments and the tendons will be calcified. Apart from that, a very important question now, which is commonly repeated. On X-ray, what is the feature seen usually? On X-ray, definitely, what will be seen? X-ray of a long bone पे क्या दिखता है? तो X-ray of a long bone पे you will see whitish appearance of the bone. The bone will appear more white, and that is what is known as osteosclerosis. This was a previous year August question and repeated again after that as well. They have asked you what is the radiographical change which is seen in a case of skeletal fluorosis. Answer options were osteoporosis, osteomalacia, osteopetrosis and osteosclerosis. So your answer has to be osteosclerosis, bachcho. Your answer has to be osteosclerosis. So osteosclerosis is a feature which is seen in cases of skeletal fluorosis on radiograph or on an X-ray. Osteosclerosis, the bone will appear more white usually. Okay? And lastly, if the fluorine level is more than 10 ppm, if the fluorine level is more than 10 ppm, then the patient will not be able to walk as well. That is called as crippling fluorosis. Okay, the patient will not be able to walk as well. That is called as crippling fluorosis. Okay, the patient will cripple. He will not be able to walk. No issues with this, anybody? That is what is about your fluorine excess or fluorosis. Please answer this question in the chat box. Jaldi se. A 14-month-old child is presenting with dilated cardiomyopathy, DCMP, hypothyroidism, inability to gain weight. That is your failure to thrive. Okay. Which supplements can help the child to improve his condition? Which supplements can help the child to improve his condition? Very good, all of you. Yes, very good. This is a diagnosis of nothing else but Cushing's disease. That is nothing else but deficiency of selenium. and that is the reason why we will give selenium supplements which can help improve the condition of the child. Very good, all of you. Okay, so this was a PYQ again. Next one that we have talking about is definitely zinc. That is the final one. Chromium to एक ही line याद रखनी तुम्हें. Zinc important because in yesterday's exam there was a question on zinc deficiency again. Okay, so that's the reason. Important. Please remember, zinc is a cofactor. We know most of the metals will act as cofactors of a lot of enzymes. And please remember, zinc is a cofactor which is required for 300 plus enzymes in the body. Yes, 300 plus enzymes in the body, they usually require zinc as its cofactor. ठीक है, तो याद रखना ये बात important. और क्या क्या functions होते हैं zinc के? Just like vitamin C, zinc is also known to enhance immunity or it is also known to strengthen immunity. ठीक है, so that is important. तो और एक question था कल के एग्जाम में, that was about wound healing and wound repair and immunity. Okay, so apart from zinc, the second one which is responsible for enhancing immunity and for wound repair and wound healing is also vitamin C. ठीक है, so you have to be cautious about whether they are asking you about zinc or whether they are asking you about vitamin C. ठीक है, so zinc is also known to improve immunity or enhance immunity. Definitely, it is also known to stabilize insulin. Yes, okay, stabilization of insulin is usually seen with zinc itself. Okay, so therefore, if there is zinc deficiency in a patient, बच्चों, definitely what is going to happen if there is zinc deficiency in a patient? There will be decreased insulin activity, right? If there is zinc deficiency, there will be decreased insulin activity, and अगर decreased insulin activity हो जाती है तो क्या होगा? Diabetes mellitus हो जाएगा patient में. ठीक है, the patient can develop diabetes mellitus. Usually not directly diabetes mellitus, but pre-diabetes develop होता है. That is called as impaired glucose tolerance. You can say the patient is having impaired glucose tolerance. That is called as pre-diabetes. Okay, the levels of blood glucose will not be diabetic, it will be pre-diabetic ones. Impaired glucose tolerance बोलते हैं उस condition को, ठीक है, या pre-diabetes बोलते हैं उसको. And apart from that, zinc is also known to prevent diarrhea in the child. But if there is diarrhea in a child, there will be deficiency of zinc in the child. Okay, अगर diarrhea हो जाता है बच्चे में, तो zinc की deficiency के chances सबसे ज़्यादा होते हैं. इसीलिए please remember, in a child who is suffering from diarrhea, definitely, in cases of diarrhea in a child, along with ORS, we also add zinc supplements. Along with ORS, we also give zinc supplements to the child. बच्चों, we also give zinc supplements to the child. या zinc का syrup पिलाया जाता है. ठीक है, important is that. And please remember, how much is the dose? That has been asked again. How much is the dose? This was a previous year question. If the child is less than 6 months old, the dose of zinc to be given is 10 mg. If the child is less than 6 months old, the dose of zinc to be given is 10 mg. But if the child is more than 6 months old, the dose of zinc to be given is 20 mg. Okay, if the child is more than 6 months old, the dose of zinc to be given is definitely 20 mg. It is to be doubled. ठीक है, so that has been a previous year question again. तो याद रखना है, डायरिया अगर है बच्चे में, तो there are high chances of zinc deficiency. So it's better that along with ORS, we also give some zinc supplementation or zinc syrup to the child. Less than 6 months, 10 mg is the dose. More than 6 months, 20 mg is the dose. No issues with this, anybody? That has to be remembered. If there is zinc deficiency in the patient, the patient or the child classically develops a condition known as acrodermatitis enteropathica. Okay, the child classically develops, or the patient classically develops a condition known as acrodermatitis enteropathica. Now, why it is called as acrodermatitis enteropathica? As the patient will have dermatitis. Okay, there will be inflammation of the skin. Where? Usually in this region, around the mouth, perioral, or in the groin region down there. Okay, inguinal region में या groin region में definitely. ठीक है? So please remember, the patient will develop acrodermatitis enteropathica. Here, the patient will have decreased immunity. Okay, the patient will have decreased immunity because zinc, we know, it is responsible for strengthening the immunity. So the patient will have decreased immunity. The patient will have impaired wound healing, because we know that for wound repair or wound healing, zinc is also responsible along with vitamin C. Therefore, जो tablets मिलती है ना तुम्हें immunity improve करने के लिए, वो कौन सी होती है? Zincovit, that is zinc plus vitamin C. ठीक है? So impaired wound healing will be there. Wound healing will not be proper and it will not be on time. So impaired wound healing or impaired wound repair. Along with that, the child will develop diarrhea. Therefore, it is called as enteropathica. The child will develop diarrhea. Okay. Apart from that, the child will have hypogonadism. Okay. Because please remember, this zinc also has a role in spermatogenesis and oogenesis. Therefore, the child will develop hypogonadism as well. Apart from that, definitely the child will have dermatitis. Okay, there will be inflammation of skin. ओके देयर विल बी एक्रो क्यों बोलते हैं, क्योंकि कोनों कोनों में होता है, अराउंड द माउथ होता है, अराउंड द इंग्वाइनल रीजन होता है. So there will be dermatitis in the perioral region, there will be dermatitis in the perioral region and dermatitis in the inguinal region definitely, okay, or in the groin region definitely we can say. ठीक है, so that is what is seen usually in a case of zinc deficiency. No issues with this anybody? And अगर zinc की deficiency है तो better is in treatment we have to give zinc supplements. Okay, last one, micromineral again. Chromium is also a micromineral which is required in very minute quantities, less than 100 mg per day. Okay, and please remember this chromium is usually responsible for production of glucose tolerance factor. ठीक है, so जो डाइट्री क्रोमियम खाते हो बच्चों, अपन जो डाइट्री क्रोमियम खाते हैं उस डाइट्री क्रोमियम की मदद से डेफिनेटली we have a factor which is formed and that is called as glucose tolerance factor. ठीक है, that is the glucose tolerance factor which is formed definitely. And this glucose tolerance factor, it enhances or it increases the action of insulin. Okay, this glucose tolerance factor which is formed from chromium, it is also known to enhance the action of insulin. तो जैसे हमने देखा था जिंक इज नोन टू स्टेबलाइज द इंसुलिन, तो जिंक की डेफिशिएंसी में द इंसुलिन इज नॉट स्टेबलाइज्ड, इट इज डिग्रेडेड वेरी सून and therefore there is insulin deficiency, therefore the patient develops IGT, impaired glucose tolerance or pre-diabetes. वैसे ही क्रोमियम में there is a glucose tolerance factor which is produced from chromium, but definitely in this patient as there is deficiency of chromium, तो क्या हो जाएगा, if the patient is having deficiency of chromium, in deficiency of chromium what will happen, there will be decreased glucose tolerance factor, and अगर glucose tolerance factor बच्चों decrease हो जाता है तो इंसुलिन की एक्टिविटी भी क्या हो जाएगी, कम हो जाएगी. ओके, and as insulin की activity कम हो जाएगी, the patient will again develop IGT. What is IGT? Again impaired glucose tolerance or pre-diabetes. The patient will develop IGT, impaired glucose tolerance or pre-diabetes itself. No issues with this anybody? That was all about your minerals now. ठीक है, so that was all about your minerals. So shall we continue with basics of biochemistry, or do you want a break of 5 to 10 minutes? Then we'll continue with basics of biochemistry. That will be the last session for today. So please let me know in the chat box. So yesterday's question, please remember in yesterday's question, one of the questions which they gave, there were questions of both zinc भी था and vitamin C भी था. तो vitamin C वाला जो question था उसमें they mentioned that the patient is having impaired wound healing. Apart from that, the patient is having gum bleeding. There are petechiae usually. ठीक है, so everything is seen. तो अगर गम ब्लीडिंग पेटिकिए सब कुछ बोला था तो इसलिए उसका आंसर तो विटामिन सी डेफिशिएंसी हो गया था. जो दूसरा क्वेश्चन था उसमें डेफिनेटली अपार्ट फ्रॉम impaired wound healing या impaired wound repair, okay, they also mentioned dermatitis in the patient, they also mentioned dermatitis, they also mentioned diarrhea in the patient. तो डायरिया, dermatitis and impaired wound healing जो था उस क्वेश्चन में आंसर was zinc deficiency. ठीक है, तो चलो take a break, 10-15 minutes break, and then we'll start with the last session of basics of biochemistry. So we'll do basics of biochemistry today, and then the next class definitely will continue with the other parts of biochemistry. Okay, biochem usually, please remember, it is actually a applied question. People start thinking that only enzyme deficiencies are biochemistry. That is the reason they are not able to find a lot of questions of biochem. But vitamins, if you consider in biochemistry, a lot of things usually are integrated. All these conditions that we have discussed, all minerals, all vitamins, their deficiencies, everything is a part of biochem itself. Therefore, there will be a lot of questions. Usually, according to the scheme, there are 17 questions, but at least we can expect somewhere near more than 12 to 15 questions definitely every time. ठीक है, and बाकी subjects में मदद हो जाती है. PDI easy हो जाता है तुम्हारे लिए, बाकी questions, बाकी subjects easy हो जाते हैं if you learn biochemistry properly. ठीक है, that's it.